I was in love with my psychiatrist and he kept me anyway. It was in my 3rd session with him.
Wait, she's already in love with this guy after session number 3?
He'd be warm and kind and wonderful. He used his psychiatric training to manipulate me.
You just described a technique that people use on dogs to get them to do tricks. Maybe that was your fault.
Then my psychiatrist realized that my boyfriend was a lot like my psychiatrist.
So that means you're crazy.
Do you see him in person? He sees people in person?
That right there is the biggest admittance that he was never interested in her. There have been 2 drastic turns. Turn number 1 was when she supposedly dated this other therapist that admitted to her that he had feelings for a client. The second turning point was when she went to hug her psychiatrist and say that they had a special relationship, and he barely reciprocated the hug and said that they have a professional relationship. Those 2 moments are so significant. Everything is being told through those 2 moments. She's so embarrassed that her coping mechanism isn't to be like, that was really embarrassing. It's to be like, oh, he was manipulating. All right, everybody. You know what time it is. It's time for a little bit of fun here. This looks really interesting. I don't know. This just looks crazy. People have been suggesting it to me. My wife got excited when I mentioned the possibility of talking about this, so now it makes me want to talk about it. So let's go. They got the comments off. This is like a 19-part series about how they fell in love with their psychiatrist, so that's definitely pretty chill. Let's go. Come on, let's go.
I fell in love with my psychiatrist.
Women usually do be talking. Why wasn't she talking?
Psychiatrist, and he knew, and he kept me until I had the strength to leave after 4 years.
Wow.
Here it is.
Like in your basement?
Part 1.
All right.
So I decided to go back on ADHD meds.
Which one? I used to be on Ritalin, baby. I came off of it when I was 16, spiraled out of control. I was an honor student until I came off my Ritalin, and then I dropped out by 18 because I just had a bunch of energy I didn't know what to do with. Isn't that incredible?
After many years of being off of them, I was on them in my early 20s to help me get through college. And then I went off of them because they just weren't, like, the side effects were too much.
Yeah, they keep you a little closed off. It makes it difficult for you to form, like, relationships sometimes. It makes you a little quiet. At least that for me.
Over the benefits.
Okay.
But then in my late 20s...
Yeah, I feel like most people that have ADHD can, like, engage in, like, cognitive behavioral therapy to refocus their energy, you know?
Read this book, Taking Charge of Adult ADHD.
All right.
And it absolutely changed my life. For my fellow ADHDers, there's so many good things in here.
Probably
and
not.
The biggest thing that I took away was that it's very important for ADHDers to be on meds.
That sounds stupid, just to be clear. If you need medication, God bless you, take your medication, regardless of what it is. Like, I'm fat as fuck. I'm diabetic. I take diabetic meds. It helps me increase my energy level so I can go and do stuff. But, like, you should generally do your best to not be on medication if you can. Try if you can engage in your ADHD in a productive way where you can engage in, like, behavioral techniques to overcome whatever symptoms you have. Because, like, I still have things. Like, sometimes I get a little too attached to my phone. I think people with ADHD have impulse control problems. That's something that I have an issue with. All these other things. Yeah, meds can help, but it doesn't necessarily mean that you need a med. If you do, get it. But if you don't, like, sometimes it's better to just kind of engage. I think your best bet is to take as few medication as you need to take. What you may or may not need is up to you to decide, but that's my general advice.
So I decided to make an appointment.
Yeah, the ADHD was in my hair, so now I'm all cured.
With a psychiatrist. I just Googled psychiatry in the city that I lived in.
I'm assuming the psychiatrist is the one that can prescribe meds.
And I went with the first one that came up.
All right,
and
good idea.
I got an appointment within a month.
Wow.
And
Pretty
then
exciting.
I booked a 90-minute intake, and I show up to the intake, and this man is my age.
Wait, he's a psychiatrist. I used to see a psychiatrist and a psychologist when I was young, and I had behavioral problems, and I was an obnoxious asshole. I think I would see my, like, therapist, my psychologist, right, once a week, and then I would see my psychiatrist once a month, just to check in to see how I'm doing on my medication. So how the fuck did she fall in love with a psychiatrist? I mean, how often was she seeing this person? Because usually psychiatrists, like, sit down with you for a little bit and they see how you're doing and they kind of like, okay, well, you know, I think they usually will read your notes from your therapist, and then, you know what I mean? Or maybe they did both.
And I can't help but notice that he's pretty attractive.
Whoa,
this psychiatrist.
that's cool. Probably helped you pay attention.
Fell in
like
love with my psychiatrist. And
like how I had a hot teacher named Miss Dorsa help me pay attention to adjust her ass and also do poorly. That's when I unironically started doing worse in English class. I told you I was an honor student. 9th grade is when I started to do worse in English class, and they had to bring me back down to the regular level English. And I think it's because I was taking medication, so I would focus on certain things. So in my Spanish class, for some reason, I would just focus on the teachers. I would count every letter in every word that the teacher said. I don't know why. In Miss Dorse's class, my little nub would smack the table, and I would just stare at her fucking ass. It was insane. No shame. I feel terrible for that woman.
I fell in love with my psychiatrist, and he kept me anyway, part 2.
Part 2.
So in this intake, you know, I kind of clocked that he was attractive in my age, but when I tell you that I've had a lot of couch time in my life, a lot of therapy.
Like masturbating? Oh.
You know, I just went right into it. I trusted him enough, of course, why wouldn't I, to tell him about my childhood trauma.
Are you supposed to tell a psychiatrist about this?
My daddy issues, if you will. What I had...
Sounds like you somehow trauma dumped on your psych. Does a psychiatrist deal with this shit? The thing that's getting me right now, the biggest question I have is how often do you see your psychiatrist? Because when I saw a psychiatrist when I was young, it was once a month just to check in. And if you're coming in and if you have the same relationship with your psychiatrist, which is basically just a 15-minute like sesh once a month, as they like, you know, they read the notes of your actual therapist, why the fuck are you telling me these things? Or why the fuck are you telling them these things?
I had went through all of the relationship trauma that I had. I was 6 months sober at this time, but like
what
all of the drinking
Gotcha.
And substance use I used to do. And he just listened and nodded. And that's the thing about psychiatrists, is that they're good at pretending to listen.
I don't understand. Why do you think he's pretending?
They can appear connected.
She says it later in the video, once a month while getting her meds for it. Dude, this woman's fucking crazy.
That doesn't mean that they're always connected.
Sorry, that's mean.
So I just felt really seen. And I also told him, I was like, look, I don't want
that's their job. Also, they're probably like, what the fuck's this woman telling me all this shit for?
Be on stimulant meds. So he listened to me and he put me on the non-stimulant ADHD med at the lowest dose just to figure out if it was going to work for me.
Yes, that's typical.
I was in love with my psychiatrist and he kept me anyway, part 3. So I hadn't ever seen a psychiatrist before.
Not for nothing, but just because you're in love with your psychiatrist and just because he knows doesn't necessarily mean it's an issue if he sees you. As long as he doesn't continuously encourage the delusion that you have, that you're in love, and he sets a strict boundary of like, oh, like I'm not in love with you, but maybe we can explore those feelings, or maybe you can explore those feelings with your fucking therapist, not your psychiatrist that you're trauma dumping on.
When I was on meds in my early 20s, I only got meds from my primary care physician.
Cool.
So I didn't understand how psychiatry works.
Yes, you did.
So because he was figuring out my med dose, I saw him every month.
Then you know how it works. You don't see a therapist once a month. This person was talking about how they would frequently see other therapists. Like they understand that therapy is typically, well, I mean, I guess it depends on your level of need, but it's usually at least anywhere from like roughly 3 times a week to once every other week. It really depends. I mean, on what stage you're in. There's no way you're seeing this guy for medication. What?
And
does she have an actual therapist at the same time? I feel like that's true.
And he just made me feel like I was his friend. He was really funny and cracked jokes and told me he was impressed with my running that I would do. And yeah.
Do you have a father? Does she have a father? Is she a did she grow up with her father? That's what like therapists will do. They obviously want you to be comfortable. And they're going to say, "Hey, good job. Good job doing a productive hobby, an exercise hobby." Like what? My fucking therapist, not my psychiatrist. My therapist used to play chess with me, and we would play chess for the first like half of the meeting, and then we would talk about my feelings afterwards. That was how they engaged with me. My psychiatrist was kind of like this older Indian guy, and I've told the story before. I'm going to tell it again. I remember one time we were talking about his home country, and he mentioned that it was like impoverished, and I said, "Why don't you just eat your dead people?" And he was like, "Well, that would not be very respectful." You know, so I was like, that's a crazy question to ask. I was in my young teens, I believe. I don't remember exactly when, but that's an interesting question to ask somebody, huh?
So, of course, I loved the attention that I got from him.
Same.
And it was in my third session with him, because at this point we were all on Zoom, that
Wait, who's all?
I asked him.
I'm sorry, did she say her fucking third session?
Third session with him.
Her third session? Wait, she's already in love with this guy after session number 3? What the fuck? Dude, if she was a boy, she would have shot up a school. Like, I'm sorry. I know that sounds fucking crazy, and I'm so sorry. Don't do that. But, like, she just developed an unrealistic, insanely quick attachment to some random person. And then if they let them down, they're going to tell their best friend not to come to school that day. You know what I'm saying? What the fuck? And who else is on the Zoom call? Because I'm assuming that it's a therapist.
We're all on Zoom. That I
Who's
asked
all?
him. I said, hey,
who else is on the Zoom call?
do you mind if I call you by your first name?
I'd say no.
And he's Pakistani, so I said his first name wrong.
That's disrespectful.
And he said, well, it's pronounced this.
Well, I think you could say his first name.
But yes, of course you can. And he seemed so smug and happy with himself. And I know
Oh, okay. So that's what her interpretation of this.
that is because that was his first sign that him pretending like we're friends was working. And to be fair to me,
Fucking 3 dates in. So we're 3 months in. And like we're 3 months in, right? This is the month number 3. I guess 2 months in, right? So, whatever. But really, we're like minute 30 in here. We're 30 minutes into this because she's having like 15-minute sessions. And when she says that we get into a Zoom call, I think she said like the 3 of us. There was an insinuation that there's another person. It's her therapist. I'm telling you right now. She understands the boundaries, and she's just like being obtuse about it in her presentation, I think on purpose.
I had only ever been to therapy before. I didn't realize that, it's important to call your doctor last name.
I don't think it's that important. It depends on the doctor. I don't think, like, it could show a mutual respect to call them by their first name. I don't think it's a big deal.
I mean, I did know that. I did it with all my other doctors, but it just showed that the boundaries were blurring, and he liked that. So from then on, from my third session on.
So just so you guys know, she reads the Akator books, and she watches a lot of Criminal Minds type like stuff, like whatever those things are called, because she's very deluded in her conspiracy theories, and she's very horny. These two things are a toxic mixture. When somebody watches conspiracy content and they get very like, and they start kind of unpacking everything in the weirdest way that they possibly can, and they also read the Akator books, they get horny and they get conspiratorial. Is that the right word? And they start to create things in their brains where they're like, this guy is molesting my mind right now, and it's making me so fucking horny. Like, that's what's happening. She's like top tier. She's a femcel gooner. She's a top tier femcel conspiracy theorist, horny gooner. This is what is really going on here.
And I started calling him his first name.
Okay.
And then his
first name was Mudahar, by the way.
He just started turning up the volume on us being friendly. And he would ask me for the first...
Dude, it's like being friendly. Dude, somehow this woman's a man. You know? Oh, he was she said hi to me. Do you think she wants to fuck? You know what I mean?
6 sessions, he asked me, after the meds, he said, how's your bowels, bladder, and appetite?
Those are definitely very sexy questions to ask somebody.
And I would say they're all normal.
Yep.
And then he would ask me any thoughts of harm. And... apparently that's pretty common for psychiatry to...
Yeah, so the meds might block up your bowels or something, and they might give you suicidal ideation. So
ask those questions. And then on our 6th session, when things were really, the chemistry was starting to be there before, like, I didn't realize it. I was like, oh, this man is just friendly.
Pull his dick out. He pulled his dick out on the fucking Zoom call.
And he said, I have to ask this because it's a special interest of mine.
He's
but
autistic.
Is there any thoughts of harm? Like,
it's like, who would ask that question?
I was special to him.
What? Wait, sorry. What was the question?
Special interest of mine. But
there's no way he asked it because it's a special interest of his.
But is there any thoughts of harm?
What?
Like, I was special to him.
I just don't believe what you're saying, because that's a very normal question.
And I said, no thoughts of harm. And he didn't.
And he was like, let me harm that pussy with my fat Pakistani cock, dude.
Ever ask me a clinical question again.
He said, you want to eat it fresh? What the fuck? That's real, by the way. That's insane.
He stopped asking me about my bladder, bowels, and appetite, and he stopped asking me about thoughts of harm.
I don't understand what you're insinuating.
So to me, I would just show up, and he was like a therapy appointment every month. I was in.
Okay.
After I risked my life.
What happened? Why did the audio quality go down significantly?
To see him, that's when he really.
Wait, what?
After I risked my life to see him.
You risked your life? What do you have on your face?
That's when he really started turning up the intimacy in
what is that? I think we have a. What does that mean? Risk your life?
Our appointments. However, he was really smart and knew the professional lines like the back of his hand.
Yeah, I think they go to school for that.
So he would comment on my appearance, but not compliment my appearance.
That makes sense because you're fucking insane and obsessed with him. My wife in the chat said he might have. I think she's referring to the questions about self-harm. But her interpretation is wrong. Like, I wonder if she was on a medication where that's not a documented common side effect, but he's seen it a lot in his practice. That's interesting. So maybe he put her on a medication and the side effects might be like, whatever, certain things. But he's just curious to see for the first few months, like maybe it does have something to do. Maybe it will have it. Like, let's say the side effects of, whatever medication, I don't know which medication she's on, is like fucking a chronic, just like constantly being obsessively horny. Like, let's say that is the side effect. Because that might be true. But there's other ones that he's noticed in some of his patients, which are like, oh, maybe there's like a bladder issue or a bowel movement issue, or maybe there are some thoughts of harm. And so maybe for the first few sessions, he asks her, hey, are you having these? And after a few months, she keeps saying no. So he's like, okay, I guess it's not the case with this person. I'm not going to continuously ask you that question because it's not a commonly associated side effect. I was just curious for a few months. So that might be the case.
So I would come on screen and he would.
Whoa! That's fucking crazy.
Say, oh, you curled your hair. Or I would come on screen and he would say, oh, you're wearing glasses.
Yeah. Did you not wear your glasses? How'd you know what he looked like?
And of course I felt seen and excited.
I love how all of this is going on through a computer, by the way. Like, she's not even meeting this guy in person. That gets me even more. She hasn't even met this guy in person yet. This could be like a fucking like really complicated AI for all we know. She's like, we're on this. Every time I come on the Zoom call, he'd be like, wow, your hair looks nice today. Because you want to know why? Because if he's asking questions like, oh, you did your hair, and oh, you're wearing glasses, what that communicates to me is this fucking bitch was waking up and then waking up like right on time for her appointment with her psychiatrist, her once a month psychiatrist, and probably wore like sweatpants and like stained t-shirt and fucking just had shitty hair on there. And or you know what I mean? And then he's just like, what the fuck? He's like, okay, I guess we're doing that. And then 7 months in, you're not a slob? Look at your hair. Holy fuck, you actually did it. Holy moly.
He was noticing these things about me. I didn't realize at this time that he had feelings for me too.
Ah, yes, of course.
I thought
How did we know that though? What did you figure out that one?
Was holding them all by myself.
Yeah.
So I was so excited when he noticed my glasses that I ran and showed him my.
That's you. Okay, now I understand. So him saying nice glasses made you feel like he has feelings for you. Now I understand.
My other pair, and he said, I prefer turtle shell glasses.
Oh my God, she's still wearing the turtle shell glasses.
So even though I usually wear contacts, I'm wearing these turtle shell glasses in these videos because just in case he sees them ever, he'll see me in his favorite glasses. He did tell me he likes the turtle shell.
Well, Mr. Psychiatrist, excuse me, sir, let me tell you something, okay? My experience is if you fuck around with crazy women, it will be the best sex of your life. But they just come with a myriad of problems, okay? And depending on how much of a gooner you are, it might be worth it. You know, if you're married to another woman, you shouldn't do it because she'll go fucking crazy and probably stab you in your sleep. But if you marry one, they can be very productive, especially if they're some kind of a mental health professional as well, because those are the most fucked up, crazy women. Of course, my wife was just a social worker. So, you know, it's kind of a catch-22. What are you down for? You know, what are you down for?
Anyway, it was just inappropriate things like that. Little teeny things that he let me in.
Yeah.
And all this time, my best friend is an emergency medicine physician. And she told me, she said, Kendra, one of these days, your psychiatrist, she would use his name, is going to say, I can't be your doctor anymore. I want to be with you.
Yeah.
I want to be with you so bad. I can't be your doctor. Yeah. I'll see you in 2 years.
Yeah, I think that you're a friend. You need to get a new friend. Listen. Women are dumb. I'm just kidding. Listen, I don't know what it is. I don't know if I've seen this in necessarily men, but I've seen this in women sometimes. I don't know what it is about female friends and other female friends. You guys are the cattiest bitches in the fucking world, but at the same time, you guys gas each other up like it was fucking 1942. Like, you guys have to stop, because you motherfuckers will feed into each other's delusions of like insanity fucking bullshit all the time. You're having a fucking 15-minute sesh once a month with your goddamn therapist. Okay? And your best friend's like, girl, he loves you. You know your friend's fucking crazy because you're her friend. I know you talk shit about her behind her back. What are you doing? That's insane. There's no way that you actually believe that. Meanwhile, men will just be like, we'll just bully someone else. You're fucking gaslighting. You're gaslighting her. Stop it. That's really inappropriate. Be realistic with your friends. That's why they do this kind of shit. It's just fucking crazy. Guys will just bully the shit out of each other. You know, they'll pick the weakest one in the group, and that person just literally will be just, you know, they will bear down upon them with mental health struggles for the rest of their life. To the point where they'll get married, and then the wife will say, you can't hang out with those friends anymore because they stress you out. What the fuck? So my best friend, who's a doctor, she picks up on stuff like that. So even she knew that our relationship was crossing boundaries. And that's crazy. You're telling her all of the information. She's not in on the Zoom call, so okay. And getting weird, but that was like, that became my dream, was for my psychiatrist, I almost use his name, to do that. And I told him about Brianna saying that, my best friend, who's the emergency medical doc. I told him that she would tell me that. And that's probably why she's stuck in the ER, because she's a fucking bad doctor. He just would be silent. He didn't disagree, but he didn't agree. You know? Yeah, I wonder what you would do in that instance. I'd just be like, okay, interesting. I guess the next question would be like, well, what do you think about that? But again, he's not your therapist. I know for a fact. I mean, I'm like 99% sure that she's seeing a therapist on the side, and like he's a psychiatrist. It's just like a monthly evaluating her response to the medication to make sure that she's still in line with what she, like, you know what I mean? That's it. That's it. Like, he's so like, well, what would he do with that information? And that was weaponized neutrality was his favorite game to play. At first, you got weaponized incompetence. Now, weaponized neutrality. Holy fuck, dude. What are we, like, what is this, politics? Are we fence-sitting centrists now? What's happening here? Weaponized neutrality? Right? He didn't disagree with Brianna telling me that my psychiatrist had feelings for me. You think he was, like, really, like, stroking his shit after after every Zoom call, but like he didn't want to like encourage it because he's like, this is wrong, and he would just like be neutral, and then he would just stroke his shit. I don't know. You know, what if we lived in her world for a second? But he also didn't say that's inappropriate. Let's change the subject. It was all okay. Oh, there's more. Also around this time that I asked my psychiatrist if he had. Well, he might have liked the attention. He's a man. He's a person. Maybe he liked the attention. I mean, she's an attractive girl. Maybe he would just listen and be like, oh, that's interesting, you know? Diagnosed me with anything other than ADHD when I had my initial diagnosis. What? It was also around this time that I asked my psychiatrist if he had diagnosed me with anything other than ADHD when I had my initial diagnosis. Wouldn't he have told you this information? Wait, does the psychiatrist diagnose? Maybe I'm wrong. My wife's in the chat. She deals with therapists and psychiatrists all the time for the people she supports. My understanding of the process is that you go to a therapist. I don't know if the therapist has the ability to specifically diagnose, but they will give their recommended diagnosis in a rundown to a therapist, and then the therapist will look at that information and interview the person, and they are the ones that make the diagnosis. I think that's how that is. So, like, yeah, he diagnoses, but, like, he's not really the one evaluating. He's just making the diagnosis, if that makes sense. Yeah, she's a diagnosed cutie patootie.
And he said, yeah, I did. I said, oh, what did you diagnose me with? And he said, well, you had a lot of traumatic things happen to you in childhood because of your dad. And
who called it, though? You have a dad? She had a dad, but he was a bad guy. Right? This is how what happens. Then they start latching on to like any fucking masculine figure in their life.
So I diagnosed you with other trauma and stressor related disorder.
What the fuck? What is that even? Is that like a specific diagnosis? So it's a diagnosis used when an individual experiences symptoms related to trauma or stress, but those symptoms don't fully meet the criteria for a specific disorder, like PTSD or acute stress disorder. Okay. So this is like, you're almost there. Okay, you're almost there. Gotcha. You're fucking crazy, but I can't quite pinpoint it yet. I wonder why they include that diagnosis. I wonder if it's that they have the ability to be a little more flexible with medication treatments without having to necessarily hit the, pinnacle. Also, I'm wondering if he diagnosed her with this. I'm wondering if the medication she was on fed into her weird fucking interpretation of the world. That's at least what I currently think it is.
And that was the first little ping that I got of like, that was weird. Why would he keep that from me?
I mean, that's a good question. I have the same question. Is that common for them to keep something from them? All right, so it's actually not super uncommon. So that they might withhold a diagnosis to avoid potential harm or stigma associated with it, or because they might not think that they're ready to hear it. Sometimes it's used to diagnosis is withheld to ensure a patient's autonomy and right to self-determination, allowing them to process the information at their own pace. Okay, that makes perfect sense to me. That makes a lot of sense. Also, would he be the one that would give that, or would it be her therapist from guaranteeing that she has?
I asked Matt, like, why wouldn't he tell me that? That seems important. He didn't tell me because he was using that information,
of course,
to manipulate me.
Of course, he wanted to Akator your brain.
He knew I had trauma and stressor disorder, and instead of helping me heal from it and telling me about
she's like getting off to the fact that she has another diagnosis. She loves it.
He used it against me.
You might not focus on it, but the diagnosis is probably like 99% documented in her appointment notes. Interesting.
I taught a yoga class.
What the fuck? Dude, this is a lesbian. This is a crazy... This person has DID. This is not the same person.
I taught a yoga class this morning.
Dude, right? Like, am I fucking crazy?
I taught a yoga class.
All right, so I could see why. So just to be absolutely... I'm going to say something fucking rude. And I don't even mean to be rude. This is what he was seeing the first 3 months. They were on the therapy calls. So like the first 30 minutes, because they're really psychiatrist appointments. I would have said she looks better here too. Look at this. She looks like I'm really not trying to be rude. I'm not trying to be mean. She looks like if I went into like some kind of AI model and said, "Can you generate me a white middle-aged lesbian human version of Sid the Sloth girl?" You know what I'm saying? And I would have been like, boop, 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 boop. Kendra. Sorry. I know I'm ugly too. But all jokes aside, she looks a lot better with her glasses on. This is what he's seeing the first few times. So he's like, so it's going to be a surprise when she looks presentable. Kind of mean. Yeah, well, that's life, dude. It's life, dude. She looks much more presentable here. Here she looks like cute and presentable. Here she looks like she's going. Maybe it's her off day and she's going to the grocery store. She just looks very different. She looks nice here. I'm just fucking kidding. I know I'm being a little mean. I'm just joking. Okay, but she looks cuter here with the glasses and like the makeup done than she does here. I think that the glasses look nice on her. Okay, I gotta put this in timeout for a minute. She looks better with the glasses. I just want to be clear. There's no contestment here. When you guys are like, "Oh, she looks better in this clip," you're objectively wrong. Okay, sorry. I'm a man. I'm a Pakistani man, okay? So I'm telling you what his perspective is. He's like, oh, you look nice here, you know? So, all right.
I taught a yoga class this morning, like I do every Tuesday mornings, and I told my regular students about what's going on for me. And
that's so normal. That's so normal of you, girl. That's such a vibe.
And how I'm sharing my story of provider abuse and how the internet is not happy with me right now.
I'm pretty sure this is her sister, her cousin or something.
And I used that to say that
she doesn't look better without them. She doesn't look better without. It's part 6. Wait, how the fuck did we get from what the fuck is happening? Dude, she ordered this like a stupid asshole. Fuck. You know that? We kind of jumped around on accident here because she's not only has ADHD, she does not organize things. So we actually did 1, 2, 3, 6, and almost watched 16. Thankfully, August was in here to catch it. So we didn't watch 16, so it's okay. So we're gonna kind of go 1, 2, 3. Now we're at 4. Okay, we're doing 4 now. Sorry.
I was seeing him every month.
Okay.
And just gaining more and more respect for him because he would just tell me these little things about his successes.
Yes, of course. Like what?
All of the cool things that he was doing in his life.
Like what? Like hanging out with his wife?
And it made me fall for him, honestly.
What were the things he was saying? And how often did he mention his wife? Those are the real questions.
And he was really good.
I feel like he's telling her about his wife. And that's a hint. He's like, I have a wife. That's the hint of that, like, hey, chill the fuck out.
At listening. And I mean, he's a Pisces, right?
And he's also a therapist, idiot, so
of course he's going to be there and be able to go deep with my feelings.
But
that doesn't mean that he wasn't extracting from
Reese, you're so deep in my pussy. Oh, sorry, that was an Akator thing. My wife's reading the book and she keeps telling me about it. It's fucking crazy.
Anyway, so I would beg him to let me see him every week. Beg him because my therapist at the time.
Boom! Hitting a dab, but not the weed kind. Because drugs are for losers. Wait, what does it look like to you? All right, I'm mirrored. Wait, what? Is this it? It doesn't matter.
He was fine. You know, he wasn't a predator, but he was fine. He just wasn't doing very much for me.
Yeah, he wasn't making you drip down there.
And so that therapist retired and I got a new therapist.
He was too old for her.
And this new therapist,
you should probably start seeing women,
who is a 75-year-old woman with a PhD, she was pretty helpful. So I stopped asking my psychiatrist, begging.
So just to be clear, he didn't say yes, which insinuates that he wasn't trying to molest your brain.
Honestly, to be my therapist and let me see him more, right?
Of course. This is so, guys. Actually, I can understand how she got there. I can understand how she got there. When it comes to her psychiatrist, she wants him to be her therapist. You know what I mean? And I understand. I think I understand it now. So this is what she's thinking, right? Because she's reading like all these Akator books and stuff, and she's like, "Oh, I want it to be my therapist. I want it to be Akator. Oh my god, this is what I want." She's fucking crazy. Sorry, that one was fucking a little intense. She's fucking crazy. Is it rude to call her fucking crazy, dude? I don't know.
should have been a red flag. But then I started focusing on this therapist. However, I would tell the therapist how obsessed I was with my psychiatrist.
Okay, I'm assuming those notes are getting passed along.
And she didn't do anything about it.
What's she going to do? Punch you in the face? What do you want? Punch you in the Zoom call? I don't know.
She just was interested. She also loved stories about my dating life.
Well, what would you, so like listen, when it comes to like a therapist, a successful or decent therapist will usually get you to come. Well, no, not that. Get you to. They have a conclusion about you, and they direct you to that conclusion. I don't want to mince my words here because she might actually think the therapist is supposed to make you come. You're not supposed to like mince your words, I think it is. So it's like, hey, you're not supposed to like tell somebody what their diagnosis is or what their problems are. Diagnosis is different to problems are. So, if you have somebody and they're like, I'm in love with my therapist. Well, this person is a little bit mentally interesting. They seem to live in their own world. In some capacity, they have a delusion about the world. At least that's what I'm seeing. And when it comes to people with some kind of a delusion, you can't tell them that they're wrong to be productive. You cannot say, that's wrong, idiot, stupid. Because then they wouldn't be delusional, but they have a delusion. So they think that they're right. They live in a particular world, and it takes a lot of reshaping to mold your brain out of that. And what that means is you constantly have to talk to them, and you have to meet them where they are at. And you kind of have to like subtle suggest and like slowly poke holes a little bit. And just kind of get into a spot where they can finally come to the understanding that they are fucking delusional. Right? So it's one of those things where it's like, yeah, I'm in love with my therapist. Interesting. Like, why do you feel that way? What is it about that makes you feel this way? Oh, interesting. So you like that he's like an authoritative male figure that talks to you nicely, and maybe, have you struggled in the past with men treating you nicely? What's the relationship like with your father? Oh, okay. This is interesting. Interesting. Okay, so your father was like super racist. Is that one of the things that makes you like your I'm not even kidding. Your psychiatrist? Is it something different? Is there almost something about them being from another country that makes you almost satisfied to be interested in them because your father was racist? Do you think that there's like a rebellion associated with that? And this is kind of how you have to go through their mind. So of course they're not going to say no. They're going to just like meet you where they feel like they have to meet you to treat you productively.
And yeah, she also was getting supply from me in her own way, but that's
what that means.
That's for another part. So so I got a new
which part?
Therapist who actually helped me. She taught me CBT,
CPT. Oh, cognitive behavioral therapy. Yeah, so that's basically when you just like you engage in behavioral changes instead of necessarily when you could do medications with it, but like you identify like, oh, you have ADHD, you're very impulsive. So like what's engaged in like cognitive behavioral therapy? So when you're feeling an impulse, you don't go crazy and make a bunch of changes to your YouTube channel. Great. Let's work on that behavior. Hey guys, let's work on that behavior. How are you doing? Más o menos.
All of these different.
Sorry, what was the other one? EBT? Is she poor?
Taught me CBT, EFT.
I don't know what EFT is. I actually want to know what that is. Electronic funds transfer. That makes perfect sense. She taught her how to use her money because she's probably too fucking stupid. Emotional freedom techniques. Interesting. A form of alternative therapy that involves tapping on specific meridian points on the body while focusing on a specific problem. Additionally, EFT can also refer to the what the fuck? That's interesting. Emotional freedom techniques. I've never heard of this before. Is this like an explicit body mic like connection? Self-help method that combines elements of exposure therapy, cognitive therapy, and acupuncture. Or acupressure. Okay, so like you put pressure on your body. It involves tapping on specific meridian points in the body similar to acupuncture while focusing on a specific emotional issue. This tapping is believed to help release emotional blockages. Interesting. Okay, it seems like all right, interesting. My wife does acupuncture and that seems to help her pretty significantly. So maybe there's something to this. I don't really know. I've never heard of it.
All of these different modalities. And so I went back to just being okay with seeing Irfan once a month while he was giving me
Irfan. Uh-oh. Now we got the therapist. Yeah, we got the third. We got Irfan.
These little breadcrumbs of making me feel special, telling me about his professional.
Fuck, dude! I looked up Irfan on Google, and it said psychiatrist is the second thing. Is this him? Is this him?
What inspired me to become a physician?
Oh my God! Is this the guy?
Actually, being a physician was a backup plan for me. This is actually a second career.
He's actually kind of hot. He's kind of hot. He's got a feminine energy to him, but not in like a negative way. He's like available,
Initially, I wanted to be a ninja. However,
yep.
I realized that there are some occupational hazards associated with it, so I had to.
There's no way this is the guy, right? Is this actually the fucking guy?
Leave that dream quite early.
Is this actually the guy?
I have never gone from feeling sorry for someone to being scared of them as quickly as I did watching that 19-part series of that.
All right, this is like way too much for me. This is so overloading and so overstimulating. I'm actually gonna fucking shit my fucking pants. But if this is actually Dr. Irfan, like, all right, I get it. I'm not doxing. I just fucking I looked up something on TikTok. It's probably not even this guy. Probably not even this fucking guy. Shut up.
Achievements, telling me about how he's getting international recognition. And it worked. I was really impressed.
Wow.
So I was.
That's so cool, girl. Let's go. Shut up. We have to find in part 5 now. This is so difficult to find. I don't even know how do we get to part 5. Thankfully, part 5 is the last in the series.
I got a new therapist. I stopped begging my psychiatrist to see me weekly. And that is when...
But you didn't think that the fact that he didn't want to see you weekly was like a potential indicator that he wasn't like sexually interested in you? Listen, if I was a therapist and I found a crazy, emotionally vulnerable woman and I wanted to take advantage of her, what I would try to do is I would be like, yeah, you know what? We can do a weekly thing. I'll even give you a better rate because I'll be your therapist, so it'll be less money. And then maybe we can even do these in-person appointments. How about that?
And the intermittent reinforcement started.
Intermittent reinforcement? Okay, she's reading books is what's happening. She's reading Criminal Minds books. She's reading, what did we call them before? Conspiracy books. Intermittent reinforcement is a conditioning strategy in which a reward is not given every time a desired behavior is performed. Instead, reinforcement is delivered on a variable or unpredicted schedule, meaning sometimes the behavior is rewarded and sometimes it's not. This method is used to maintain a learned behavior over time, even when rewards are not considered provided. Okay, so basically, it's when you want your dog to do a trick, and sometimes you don't give them a treat. And then Halloween. Trick or treat.
Some sessions, he'd be warm and kind and wonderful and let me in on little parts of his life. And,
like his wife and his kids?
And like be vulnerable with me or pretend. Other sessions, he would be cold and clinical and detached. And
whoa! I wonder why. Maybe he's a person with feelings, and sometimes he just has different responses to different things. When you're having a bad day, sometimes you don't act happy. Oh fuck! And you want to know what's crazy? Psychiatrists are people. Isn't that interesting?
You know what that did? It made me work harder in our next sessions. It did, and it started the addiction that I had to him.
That's crazy.
100%. And he knew exactly what he was doing. This man gives lectures on trauma and attachment theory.
Yeah, does he?
He used his psychiatric training to manipulate me and get me hooked. And guess what? It worked.
You just described a technique that the people use on dogs to get them to do tricks. So if you were manipulated maybe that's your fault. At a certain point, at what point do we get to where this woman's fucking like, if you're easy to guide around emotionally, just like a dog, maybe something's going on with you. Maybe you have a problem. Maybe this is an AU issue. Maybe he's unintentionally grooming her. We can't really unintentionally groom somebody, but it seems like, but based on what she's saying, she's telling us that that he had the effect of grooming her, basically, in some capacity, because she's very emotionally vulnerable. But I don't think he realizes what he's doing. I think, again, one of the biggest things that I want people to take away here is I'm fairly confident. I'm like 70 or 80. I might even be higher than that. Confident that he talks to her about his wife. And I feel like she's not being specific, and I feel like it's intentional. And I want to know what he says when he talks about his wife.
In January of 2024, I was hit by a car turning left as I was going through a green light.
Like, were you in a car, or you just got hit, like, on a bicycle?
And it was the night before my next appointment with my psychiatrist.
Okay.
So I was like...
I was more worried about missing my psychiatry appointment than the car accident and my health. Wow, that's... Maybe go out and get a hobby.
Okay, I'll still be able to go to my appointment on Zoom. I'm okay. But I did make an appointment with an urgent care the next day just to get checked out. I had bruising on my abdomen and a perforated eardrum.
Okay.
And the provider at the urgent care said, I do not feel comfortable treating you. You need to seek emergency care now. Mm-hmm. You may be internally bleeding. Whoa. But it was 11 o'clock in the morning, and my appointment with my psychiatrist was at 2. Damn. So I decided that I was going to wait so I could see my psychiatrist and not have to reschedule. Because
yeah, but that's just the problem. Now I'm understanding her problem and why he didn't make the advanced move. She's internally bleeding. How often do women do that? Once a month. He's not trying to hit when you're on your period, girl. Have you thought about that's why he never escalated and had sexual intercourse with you? Because you were always seeing him when you're on your fucking period? Think about it. You should have missed the appointment, and you should have changed your cycle. Really, realistically, if you wanted to get him, you should have changed your appointments to your ovulation cycle. This way the pheromones would go through the computer. And he would sniff them. He would be like, holy fuck, like, this is crazy. There's something about you. Something to think about. That's something to think about. Smart guy.
Because I was looking forward to my appointment with him so much.
So much. It was so fun.
I look back at that time and I'm just like, oh my God, I put my own life under seeing him. I was fully addicted to him at this point.
Crazy.
And you know what happened?
No.
Is that I showed up and I told him that I may be internally bleeding, and he didn't stop the appointment. He didn't say, you need to take care of yourself. Go get emergency care now. Yeah. He let me continue and just tell him about how much I loved him and how grateful I was for him. Because that was really what most of our appointments were, is me just like pouring myself out, because he was so good at the intermittent reinforcement.
Right. What does that look like to you? What is he denying you sometimes but giving you other times?
Yeah.
Or it's his positive attitude. So that's fucking so stupid. So what she's saying is that he's trained, because she's talking about whatever. That's basically training a dog to do tricks without getting a treat. So what he was rewarding her with was a positive attitude. So they would come on the call, and she would tell him that he was so cool and awesome, and sometimes he would be nice about it. He'd have a positive attitude, and sometimes he would have a negative attitude. So just to be clear, that's not at all what fucking intermittent reinforcement is. That is her thinking that she's intelligent, reading about this thing, and projecting that onto her life and incorrectly. Because that makes absolutely no fucking sense to me. That's not intermittent reinforcement. All right? Especially since you're saying some days he would be warm and some days he wouldn't. That's just him acting differently. All right? Like, if he would start jacking off sometimes when you said it, and other times he would just sit there as you said it, and then maybe we have something there. But it doesn't sound like that. I also want to know what the notes are from the therapist, and I don't know how honest of an actor she is, because maybe she would sometimes sometimes she would talk about how much he liked her, and maybe the notes from the therapist said that she needs to interact in a certain way. Like, the notes from the therapist might have been like, hey, when you hear her say these things, just keep a neutral tone, because I need to handle her a specific way, because she's very mentally fragile. Because I would not doubt that at all.
I got some warmth from him that appointment.
Whoa, did you start farting?
So that was January 2023. Wow, and I also told my therapist about this. She said nothing.
Okay. Maybe that happened. All right, now we're on part 7, and then there's a 7.5, because we already did 6, so we skipped it.
January 2023. At this
Yeah.
point, I was full-blown obsessed with my psychiatrist.
Crazy.
And
when did she start the appointments? Did she say?
my therapist wasn't helping me. My psychiatrist wasn't helping me. He was feeding it. And then I got a boyfriend. And at first, my psychiatrist wasn't really that keen. But then my psychiatrist realized that my boyfriend was a lot like my psychiatrist.
Okay, so that means you're fucking crazy, to be clear. So what I just heard was, hey, I found some boyfriend that was just like my therapist because he wasn't making himself available to me. And maybe to potentially make him jealous.
And then I started talking to my psychiatrist about my sex life, about
That seems like something you could probably tell your therapist.
tracking my cycle, using the fertility awareness method.
Ooh. What?
And my psychiatrist loved it. He didn't never say, this isn't inappropriate to...
Well, I mean, if you're talking about keeping your ovulation cycle in check so you don't get pregnant, I don't know why he would say it's not appropriate. Why would he say this isn't an appropriate conversation?
your care, let's pivot. Oh, he just let me talk and talk and talk about my sex life. And
Why do you... What? That's interesting.
and I didn't get too...
She definitely has ADHD. This is the first time I've looked at somebody and got like, oh, they have ADHD. She's perseverating about a particular a tendency. She's very impulsive in this particular tendency. It's her special interest right now. She's really into it. Like, she's probably having a really good sex life right now with this guy that she started dating. He's fucking the shit out of her. She's thinking about her therapist. This probably feels really good for her. It's something that she's like really interested in right now at this second. And she's like, really, it's a lot. Like, that's what happens with, me. I get like, I love this idea and it gives me a lot of joy and I talk about it. And then one day it's kind of over and now it's just like, it exists, right? So this makes sense as to why she would engage in this behavior, and it makes sense that he would just let her talk about it because this is her current thing to fucking perseverate on. Of course. What? Okay.
too deep. But about a year and a half in, and I would send my psychiatrist these emails just about how much I liked him and how I
Were those billable hours?
was so grateful for him and
Wow.
put in a bunch of heart emojis.
That's weird.
And this is really when he should have transferred my care, but
Not necessarily.
he waited. He liked what I gave him too much.
Maybe he was taking recommendations from your therapist.
And so even though my boyfriend did not meet my needs,
What does that mean? Sexually, physically?
my psychiatrist and my therapist both were like, you have to stay with him. There's nothing wrong with him not meeting your needs.
I don't think I believe any of that.
Like, okay. And my psychiatrist was like,
If he actually said that, though, wouldn't that insinuate he's not interested? Like, let's say that that's true, which it probably isn't. There's something that we're missing. Wouldn't that mean if he wants you to stay with somebody that's not compatible with you, isn't that him telling you, like, wouldn't that be a sign that he's not interested in you because he wants you to be unavailable because you're, like, obsessed with him?
he's perfect. Don't get wrong with him. And what was perfect about him was he wasn't meeting my needs. So I was still coming to my psychiatrist.
Oh, gotcha. Okay, so that's the delusion. Idiot brain. Sorry. That's what it is. So in her mind, he wanted her to see this guy that was not good for her because it would mean that she needed to see the psychiatrist more. Gotcha. She is delusional. This person is scary. I need you guys to understand something. This person is like very scary because this is the type of person who has a particular, or they have a perceived way that the world exists. They have a particular way that the world exists, and nothing that you can say or do will ever change the way the world exists. And that makes sense as to why the therapist and the psychiatrist are treating her in such a way, because she's so fucking delusional. You have to meet the person where they're at and slowly try to redirect. And that, for how fucking crazy she is, slowly is a fucking, I mean, it's going to be as slow as her fucking turtle shell glasses here. But she has a way about the world, and like you've probably met people that have this type of thing where it's like they will engage in a particular behavior. Let's say they engage in like a bad behavior, and it makes them feel really good. And you might say something like, "Hey, that's not a great behavior." Oh yeah, I know. Oh yeah, I know that. And they just say that because they're more interested in kind of dissuading you or placating you or kind of getting you off the topic so that they can continue to live in their delusion. And they'll go right back to expressing their delusion because that's what they're looking for. They're just looking for constant reinforcement of their delusion. And so they'll either drop you if you're not supporting it enough, or they will just say, oh, yeah, yeah. And they'll redirect a conversation pretending that they have acknowledged that problem. That's what this person is. And that's a problem. And that makes sense as to why she's some kind of guru. Because she's so fucking delusional. She's helping, she's a guru, helping ADHD to become empowered. She's so fucking delusional. She's on the border of intelligence that she has like Dunning-Kruger effect at this point. Like she's at that point where she's intelligent enough to express herself, but she's too dumb to be self-aware. She's like right on the cusp there. She's in a very dangerous model. I don't know if danger is the right word, but okay.
Looking for emotional validation,
Sure.
which he would drip to me slowly.
You got that drip. Gotcha.
So my therapist, who I didn't know at this time had bad boundaries, but she did. I went to her
Why?
because my boyfriend and I, after like more than a year together, we started having
A year has passed now, so now we're in 2024.
issues in the bedroom.
Gotcha. He's not sexually
And so I
satisfying
went
you.
to my therapist and she asked me, what does your psychiatrist think about this? And I said, I don't know. I haven't talked to my psychiatrist about this stuff because
You just told us that you did.
I have a crush on my psychiatrist and I don't want to tell him this intimate of stuff. And she said, well, you should tell him because I want a male's perspective.
I don't know how much I believe that. I wonder if she's on a medication that like has an impact on her sex life. Maybe it reduces her libido. Maybe it increases it. Maybe it could reduce it, or it could make like a numbing effect, making it more difficult to satisfy her. It could increase it, and maybe he can't keep up with that. I wonder what it is.
So at my next appointment with my psychiatrist,
Didn't she just say earlier that she was talking about it with him though?
I told him, I said, today we're going to talk about my intimate life. And he said, oh,
I thought I could have swore she was already telling them these things. Did she not, or just say that to us?
I said, yes. My psychologist, my therapist asked what your opinion on it was. And I told her that I don't talk to you about this intimate stuff because I have a crush on you. And he looked down and smiled so big in that moment.
I don't think I believe her. It's hard to, because I could have swore she just told us that she was talking about the sex life once they first started dating, no? Although maybe she started... Oh, actually, this tracks. Wait, this might be somewhat honest. This might actually make sense. She starts dating the guy. She's telling them about sex life, blah, 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 blah. It's her fixation because she's enjoying herself, right? She's got fucking ADHD. 1 month is over. That's not her current like the focal point, and now she's not talking about it because her like overjoy with this new sex life with this guy that she said is very similar to her therapist and her psychiatrist, and I also think he's like a brown guy, like a Pakistani guy, yada yada yada. And now we just jump forward. She's not telling him because it's no longer the interest of the new relationship no longer outweighs her weird affliction for her psychiatrist, and so now it's back down. And okay. Gotcha. And now what we have is the fact that she feels bold enough, in her story at least, to explicitly tell the psychiatrist that she's attracted to him, means that she's fantasizing about the psychiatrist being a replacement to the boyfriend. And now we have this weird fucking obsession scenario going on here. I think. I'm doing a lot of speculation, but this is what it feels like. This is what it kind of feels like. Like the odds are impossible, but it's still working out. Like now she's okay. Let's see what she has to say.
He smiled so big, and I loved it. It's so gross thinking about it.
Why?
And then I proceeded to give him 30 minutes of non-stop content about my intimate life.
What does that mean? Oh, okay.
With my boyfriend. And I actually recorded the whole thing because I was so excited about it.
Are you going to show us?
But now it makes me sick. I can't even listen to the recording.
You recorded it? That's weird. Why?
I've tried to start, but
It's gross. Any ethical psychiatrist would have stopped.
Also, fun fact, her psychiatrist specializes in schizophrenia, not ADHD. Found online. She leaked his name. Did she leak his last name?
Stopped me and said, Kendra, let's talk about your meds. Let's talk about your care. At this point, my meds were stable.
This makes sense, though, that he would redirect the conversation.
And I was still seeing him every month.
Wow, like
yeah, that was a rough time. And it was...
You're still thinking about it, though.
Pretty much his Christmas morning.
What is, does he celebrate Christmas? What's the current therapist, psychologist, or psychiatrist think right now?
The almost 2.5 years of grooming me to get me to talk about sexual...
What did I say?
Things with him.
That's crazy.
Worked.
He was grooming her. So just to be clear, he was grooming her by making her feel comfortable so that she would feel comfortable to express sexual things so that he could escalate at her pace. That's fucking insane.
And he got 30 minutes of nonstop content to use.
Wow. Do you think he was like jacking off to it, or what do you think? All right, 7.5.
I need to address 3 things.
Backwards hat lesbian, by the way. Come on, give me a break. Let me give you guys a little advice. Think about anybody in your life, a girl, and think about them with a backwards hat on. If the girl like looks a certain way with a backwards hat on in your brain, they're probably either bisexual or a lesbian. Look at any girl, especially ones that don't have boyfriends right now, and they're a little older in their mid-30s. If you look at them and you're like, if they had a backwards hat on, they might be slamming puss. Just a little advice for you. A little off topic.
1, people are asking me what my mental health diagnosis is.
Yeah, good question.
I do not have BPD. I do not have psychosis. I have ADHD. And I was experiencing extreme
I think she means like ADHD. Like she's got something going on different.
With my psychiatrist.
We don't got the same ADHD, girlfriend.
Extreme limerence with my
Extreme limerence. Extreme limerence is a state of intense infatuation and obsession, an obsessive desire for another person, often characterized by intrusive thoughts, physical discomfort, and a belief that the other person reciprocates the feelings, even if there's no evidence to support it. Wait a minute. Hold on a second. Why is she saying this? This is a self-report.
And I was experiencing extreme limerence with my psychiatrist.
So just to be clear, definitionally, limerence is when you have an intense love for somebody, even if there's no evidence to support it. And so maybe she just... That's what limerence is, when somebody doesn't reciprocate. So that would be her So, I mean, 1, it's possible she doesn't know what limerence means. But I doubt that, because she is a pseudo-intellectual. She's a pseudo-intellectual who thinks she knows what the fuck she's talking about with any of these things. Right? Like, she literally comes up with words and then she applies them to her situation, even if it's unjustifiably. Right? Like, she did that before with, like, grooming and whatever other thing that they mentioned before that doesn't make any sense. The dog behavior. This doesn't make any sense. I want to see what's this?
Limerence is a normal thing to happen to anyone who is experiencing hot and cold behavior from someone. And it happens...
No, it's not.
...more often in people with ADHD because we have dopamine dysregulation and rejection-sensitive dysphoria. And guess what? My psychiatrist knew that and used it to his advantage. 2.
But extreme limerence literally means the other person's not showing any sign of reciprocation. And even if what you're saying is true, we're not self-aware enough. We're not self-aware enough here, because what she thinks limerence is, she thinks extreme limerence effectively means that you fall in love with okay, I'm understanding what she did now. Now it makes sense why she's calling it limerence. I'm just trying to see how she's projecting it onto her relationship incorrectly. So limerence is when, like, extreme limerence is when you fall in love with somebody and they don't show any signs back, but you are an idiot. Right? That's the layman's way to express it. She's saying he intentionally gave her extreme limerence as like a grooming tactic, right? Okay.
I accidentally said my psychiatrist's first name in one of my videos. If you clocked it, good for you.
Good.
I do not owe him anonymity. However, this is not about...
Funny enough, he owes her anonymity. It's part of like literal doctor stuff, so he can't even really come forward.
Out doxing my psychiatrist. This is about me sharing my story so other people can view predatory behavior in people in power. Okay?
Incredible.
If anyone doxes my psychiatrist with his last name or city that he works in or clinic that he works in.
She's encouraging you to do this, by the way. This is what this is. It's an insinuation.
Your comment will be immediately deleted and you will be blocked.
Okay, but you're describing the way that you would do it. Because I never would have thought that. Oh, well, let me figure out where she, like, what state or whatever she lives in and go from there. That's crazy. Don't do that, but...
This is about protecting other victims, not doxing my psychiatrist.
Okay.
If you do...
But, like, wouldn't doxing your psychiatrist protect other victims? You shouldn't be doing that because he's not a predator from anything that she said. But wouldn't that be a way of protection?
Some investigative work and you want to DM me about it, I'm open to that. Okay.
There you go.
Okay. 3.
Incredible.
I need to take a moment.
Yeah.
Moment taken.
That was a lot of...
It is so incredibly disturbing to me. The amount of people that are predator protectors in my comments.
True.
That
So
are
true, Queen.
victim blaming me.
Love you.
Especially the mental health practitioners in my comments using therapy speak to say that this situation that I was in was my fault or that I was delusional. Check yourself. You're giving me more ammunition to share my story.
Okay.
Because it just goes to show how absolutely messed up the mental health industry is.
So true,
and
Queen.
how
So
protected people who do this kind of sick psychological manipulation are. So I will continue with my story tomorrow. I will see you all then.
That's crazy. You think that maybe her therapist would want to fuck her if she showed her tits more? She's kind of dry, you know? We found 8. It's like the 16th one in the series, guys. Don't worry about it. Let's do it.
Welcome back to another installment of I Was in Love with My Psychiatrist and He Kept Me Anyway, Part 8. You all did some nasty work last night, and I had to turn off comments. People started posting my psychiatrist's first and last name, his picture in the comments.
Oh, so they legitimately found out who it was. I'm so curious who it is.
That was a jump scare. So
wait, so is that verified? Somebody had mentioned it before. I don't know how like real it is, but that he's a doctor that specializes in some kind of like schizophrenia.
Oh, yeah. A few bad actors who wanted to be super sleuths got
Jason Momoa. Sorry.
The privilege of commenting, mostly hate, let's be real, taken away for everyone.
Damn, so bad.
So at this point in the story, there are 2 main players. My psychiatrist, who's my age, who crossed...
Was it legitimately the guy that I showed for fucking real? I don't know. I don't know if this is like 100% verified. I don't need to show it on the screen or anything. But if this is the same guy, first name matches up. I don't know about the last name. This guy he does seem to specialize in schizophrenia. Professional interests include schizophrenia, novel therapeutics, or for PTSD, and psychomatics. I don't really study and treatment of how psychology factors interact with physical health and disease. Interesting. Well, that would make sense why he would be interested in her doing yoga. That's actually makes sense then. If this is the guy, all of this makes a lot of sense. Okay. Interesting. Okay.
Major ethical boundaries, and my therapist, who is a 75-year-old woman with a PhD.
Whoa.
Neither
player hater degree, am I right, guys?
These people, at this point in the story, I knew were crossing boundaries. I thought that everything was hunky-dory and that I was...
Why? So my question is, why does she think that they were crossing boundaries?
Just in love with my psychiatrist, and it was totally normal. Little did I know he was manufacturing everything,
Crazy.
so I could fall in love with him. because it was on him to set the professional boundary and not let attention build. So
what does he do? Because I don't know her or her state, like her mental state. Well, I know part of it, but I'm not a fucking there. I don't have a PhD. You know, I'm not a doctor in something. I'm not a psychiatrist or anything. But she has like a weird vulnerable state. I wonder what, like, if he dropped her, like her mother probably dropped her on her head when she was born. I wonder if that perception of loss would be so great for her that it would cause her some kind of problem. Like because she has an extreme infatuation. So I wonder if they're not dropping her. One, because it might just be she's engaging in a certain way. Like, you know, you can't just drop the person. That might be unethical. But maybe dropping her would be too much of a loss in her life. That it would be too great. It's like it might just be too much for her. It's like the reason why when you go and work in group homes, you try not to get too close to the people. It's going to happen inevitably, but because if you leave, you quit your job, but that's like your family to them, and so that's like a loss for them.
Days after my psychiatrist's Christmas morning appointment from a few videos back, where he got a crush confession from me, and then 30 minutes of nonstop intimate content that he did not stop me.
What? Oh, content.
My boyfriend and I broke up days later.
Whoa.
So then I started dating this other guy. And this other guy, this
she do be slutting around.
New guy, was a therapist.
Oh my God.
And I was like, oh great. Someone who will be able to emotionally meet my needs. Yeah, I'm not going to date another therapist again.
It's tough. Dating mental health people's tough. They're always fucking diagnosing you. You know.
So this therapist and I, we went for coffee. It was nice. Our second date was a hike. And
hike? Dude, that's fucking crazy. Not me. No thank you. First date, Applebee's. Second date, Chili's. Hike?
And on this hike, this therapist starts telling me about how he has a crush on one of his clients.
Whoa. And this put the idea. Oh, okay. This makes sense. That's crazy. They're on a second date. He's on a hike. He's probably scared and doesn't want to die. So he's like, oh, I'm not really interested in you, but in a different way. You know, he realized on the hike that she's fucking crazy. So he's like, yeah, I actually have a crush on my therapist. All jokes aside, this might have actually started the delusional thought. And like filtered all of her previous thoughts through this thought. She's dating a therapist. And then he's like, oh, I have a crush on one of my people, on one of my patients. And then maybe she likes the guy. So this makes a lot more sense. Because what I think happened here was that she started talking to the psychiatrist and the therapist and all that. And she like liked the guy in a way that wasn't necessarily concerning, but it was a developing crush, and she couldn't really get it out of the back of her mind. And then she started dating a therapist, and he described that he was in love with it, or he liked one of his clients, and he described it, and she started to take that and do what she always does, which is apply it to her life in some kind of way. And then that turned into taking that moment, from that moment, like, see, what are we, like a year and a half in? And she decided to go back, and she took that moment in her life here, and she put it back here. She took it here, and she put it back here, and then she started to rethink about it, and she filtered it through this new concept that she had of like being infatuated, and all of a sudden everything made sense, and we omitted certain facts, like I'm telling you this guy has a fucking wife or something, to fit the delusion.
And I thought to myself, okay, this is strange, but go ahead. Like, we're on a date, dude. Why are you telling me about a crush on one of your clients? But go off, King.
Go off, King.
So then he was saying, yeah, she's so attractive, and I think she likes me too. I go and visit her at work, and her coworkers say, oh, so-and-so talks about you all the time. And I was like, okay, where does she work? And he said, well, I shouldn't tell you that because I really shouldn't be visiting her anyway. I was like, okay, no problem. So then he continues, and he said, yeah, she wears these red lacy panties and short skirts.
That's horny.
And I know she wears them for me.
Oh.
And like alarm bells were going off in my head.
That's actually a fucking crazy thing. I don't even know if this is true, but that's an interesting concept. That's one of the problems with men. One of the problems with men is that I accidentally clicked off. I was making a point. That's one of the problems with like dudes is that they'll think that like a girl does a thing for them and it makes them feel entitled. You know, it's an interesting thought, you know, but you can't be like, oh, that girl's wearing these panties because she wants me to look at her. Don't get that out of your fucking head unless it's your wife. And obviously it's true. That's how I feel. My wife, like, she'll fart and I'll be like, I know she's farting for me. You know what I mean?
And like alarm bells were going off in my head. Mind you, I had no idea that my
literally, she thought they were going off in her head. It was a delusion. The actual alarm bells were going off.
Psychiatrist had similar feelings towards me at this point. But I just thought, wow, this man is borderline predatory. And he said, yeah, and you know, she just is so attractive that I have to smash mermate.
Yeah, Jack. Yeah, he has to masturbate. We got it.
Before every session.
Whoa.
Because I just have to
He's got to get the goon juice out.
Get that energy out of me. And I was
crazy.
Like, okay. And yeah, he just felt compelled to tell me. And I did not understand why. Now I do.
Because God put him there to tell you this so that so that you would understand your relationship with your therapist. Do you ask your psychiatrist? Do you ask your psychiatrist if he jacks off before every meeting?
So he told me about how he's a predator, right? Another predator in the mental health industry.
He might not be a predator. The predator means that there's a heavy amount of intentionality to manipulate. It's inappropriate regardless if this is true that he was attracted to a person that he was treating. It's unprofessional and it's inappropriate because there's a certain love, like there's a certain relationship you develop, the vulnerability that's to some degree almost like artificial, I guess, and you know, or it's different. There's different boundaries with it. So that could be inappropriate. I don't know if he's predatory. Predatory means he's like consistently basically trying to do these relationships so he could take advantage of these women after he figures out like what makes them tick. That would be predatory, but we don't have to go into a whole conversation about it, but I just think that's it's appropriate to understand that, and I can't trust her interpretation of anything. So
shocker. So then at my next appointment with my psychiatrist, keep in mind, it had been 6 weeks of nonstop fun for this man. He got to use my crush confession and 30 minutes of content.
Why does she keep calling it content? This is so strange.
Oh, for whatever he wanted to use it for, right? And if my psychiatrist was good at anything, it was being professional and acting professional.
Okay, that's so damning for him, for you to say that. And
technically not crossing any lines. Gotcha. And he thought that he was so good at it.
He was so good at setting boundaries. He thought he was good, but I just didn't interpret it that way.
Because he was good at it. But that doesn't mean he wasn't doing it. And so...
It kind of does. It kind of does mean that.
I told him, I said, yeah, Bo and I broke up. He had known about...
Because she's saying it's... Oh! Okay. Oh, I didn't think of it like that. So this is, my wife said in the chat that the reason that she keeps calling it content is because she is saying that it's porn for him. He jacks off to it. He's jacking off to her, whatever description of her not being satisfied by her boyfriend. This is, what did I say? It's Akator, the book, the porn book.
About this other guy, my psychiatrist, I had mentioned him. And I told him that this new guy and I went on a date and we went on a hike. And I literally had no idea at this point, I'll say it again, that my psychiatrist was predatory towards me. I almost said his first name again. I'm going to do my best to not.
Crazy.
So
just refilm the other one or like edit that out and re-upload it. Everything's out of order anyway.
I went to my psychiatrist and I told him this story about this man that I went on a date with who's a therapist is relieving himself before appointments.
Really just jorking it, yeah.
And talking about his client's panties and doing all of these other extremely inappropriate things like visiting her at work. And this man, my psychiatrist,
He said, got any pics?
Looked like he had seen a ghost and like he was gonna vomit.
Ah, yes. And the reason why, from her perspective, is because, I found him out. There it is.
Because
it couldn't be because he's like, holy shit, that's a horrible ethical boundary. No. It's because she found him out. And once she saw that reaction, it hit her right in the confirmation bias. And she was like, there you go. This is proof.
He prided himself on being an extremely professional and buttoned up person.
The problem is that you don't wear lacy red panties because you don't even show your tits. I'm not saying I want to see your tits. But all I'm saying is that, like, she's not even putting any provocative energy out there.
But here I was holding a mirror to him with exactly what he was doing, but a bumbling idiot telling me, like, how he was doing it without the fancy degree, without any of that.
Wow.
I look back on that.
What was the therapist? Just like a social worker that was able to do, it's not called therapy technically, I think. It's called, something like that.
Now, and it's just crazy. And so it just tainted all the fantasy material that I'd given him the session before.
Fantasy porn. That's what she's saying. Porn. Akator porn. Guys, don't read books to jack off. If a guy reads a book to jack off, he's fucking gay, okay? Guys need to look at something and grunt. Already found 9, baby. Let's go.
Hi. I need to say something really important. And that's that it seems as though...
What is it, that you're, like, living by a train?
Many people view what I'm going through as a crash out.
Yeah.
What I'm doing...
In layman's term, sure.
As a mental health spiral.
Yeah, that makes sense.
And of course it seems like that.
It is that.
I get it. It's an extremely dark thing to talk about. All of this that I went through. And I am sharing my story because it wasn't out there. No one...
Did he touch your vagina? Because none of this makes any sense, though. Right? Like, just to be clear, none of this makes any sense. Wouldn't you want him to fucking brain molest you at this point? Like, my thing is that you are in love with this guy, and your whole thing was that he groomed you to love him. So, what, like, did you all of a sudden fall out of love with him? The answer is no. Because she's still wearing the fucking glasses in every video except for one so far. She's still in love with this guy. And so if you did find out that he wanted your pussy and you exposed him, why wouldn't you just make yourself more available in a more explicit way? And why wouldn't he fuck you? None of this makes any sense. You're like right at the spot where he could sweet spot fuck the shit out of you. And you probably wouldn't say anything. And even if you did, no one would believe you, right? No. Because you're crazy. No. I feel like, wouldn't he escalate from that point on? Because he, like, what is his end game? You're saying that he's grooming you to fall in love with him. Like, what's his end game if it's not to see your pussy or your fucking tits or something? Or your red lacy bra. Sorry for being explicit. What's the end game here? Are you going to tell us that he escalates, or does he still maintain the relationship where it is? Because if he doesn't escalate, what's the point of him doing that? Just so that just because he can? In her words, because this isn't really happening, I don't think. What?
No one else has shared a story like this.
Whoa.
But I know that it happens a lot because people are in my DMs telling me that the same thing that I went through, they went through too. I am now in TikTok jail. I got a violation on the video where I talked about really the biggest damning evidence against my psychiatrist.
What was it?
And
I guess the train passed.
And so...
Or she's making a cup of coffee.
Because of that, I have to be really careful. So I'm going to do my very best to not be reactive and to share my story from a place of generosity. Because the people in my DMs telling me that they've been through this too, it's keeping me going. It's not my mental health spiral.
You know who else was getting validated in their DMs? The guy who shot that school up. I'm not kidding. This woman has school shooter energy. She's She's a fucking threat. She's fucking crazy. If she was a man, we'd be in more trouble, okay?
And I can understand that for some people in the mental health space, because they have been some of the loudest people to speak out against what I'm doing.
Okay.
It's hard to grasp that someone could have this level of predation.
She's honestly, it's one of those things where she's like so fucking delusional. It's not even worth getting riled up. Like she's just very delusional. And I think that this whole mental narrative that she's painted makes her beyond help. And so she's pretty much a lost cause from this point on.
A high place of power. So just in case my video doesn't get put back up.
How do you know she's over 6 foot?
When everything changed.
If she's over 6 foot, that makes it even harder to believe that this guy wanted to fuck her.
Changed was when my 75-year-old therapist.
Why do you keep telling us 75-year-olds?
I went to her with intimate details, and she suggested I go to my psychiatrist with them.
Okay.
And I felt so excited and nervous to share that with him because I had such a big crush on him at the time.
I thought you already told us about this.
And I recorded all 33 minutes. So this is why, if my psychiatrist wants to come with me and like
come to you,
sue me for defamation, I have a 33-minute recording of me admitting I have a crush on him.
Okay.
And speaking about extremely intimate details.
There's really no reason. He's not being defamed. That's the thing. It's like, I think that most people are looking at this and like, oh, she's out of her fucking mind. So, and considering her perspective on this so far is so off, the 33-minute audio is probably nothing.
It was in that moment that he really, really should have transferred my care.
Why? Based on what? What is your job? What job do you have? What credentials do you have?
But that moment changed everything for him too, because that's when things really started.
You wonder if she was sharing that on live? Did she?
Getting deep between us.
Whoa.
And this is where the story is going to go from now. It's going to be a good story.
Oh, great. And I'm hoping for it.
I'm going to try to tell it all today. Wow. Just in case one of my videos does get banned so people can hear it. But just know, if you're concerned for my mental health, thank you.
Not really. Maybe I should be, but I'm not. It's unfortunately for you, I guess. Not really. It doesn't really matter if I am or not.
I am very good.
Yeah.
More than good, actually. And I am actually a coach for ADHDers. It says it in my bio.
ADHDers. Wow.
And I help people work through self-limiting beliefs.
She's ADHDers in her employment.
I help people work through numbing with alcohol and cannabis, because these are the things that so many of us do to avoid our truths.
Actually, this kind of makes sense in the sense that I think people with ADHD are more prone to addiction. Like I've talked about different addictions that I've had before. She's probably gone from an alcohol or / cigarette addiction. I think that she has like a legitimate porn addiction. I'm not even kidding. I think that she I think that she has a porn addiction. I think that she doesn't smoke cigarettes or drink alcohol or do any other drugs anymore. So what she does is she's addicted to porn, and the type of porn that she's addicted to is audio porn. Excuse me. It's readable porn. She's addicted to readable porn. Just because you're flicking your fucking bean, or you're just sitting there, squeezing your thighs together, rubbing your fucking bean so you can goon for 5 hours a day while you read ACOTAR books. Just because it's not an image doesn't mean that you're not a fucking addict. You're not a freak addict. Fuck. Okay. So I'm telling you that this is something that she engages in. Like, she's a legitimate lady gooner. She's addicted to porn and sex, and that makes sense as to why she's having problems in her sex life with her other boyfriend, because she has a high sex drive and he's not accommodating that. She's not giving audiobook listener. Yes, she is. She's 100% giving audio. She's giving audiobook listener / true crime listener. That's exactly what she's giving. I'm telling you, she's gonna slip up, and I'm gonna be right.
And this is my truth and what I went through.
Also, it's funny that she has a Jesus Christ sticker in the back, because that tracks too for some kind of addiction. they usually turn to, like, you know, religion. All right, let's continue. I had to pee.
You really started going.
Let's continue. I had to jack off. I had to jack off because she was making me so horny. I needed to maintain professional boundaries.
Charts with me and my psychiatrist, and I held it alone for months, like after that Christmas morning appointment of his, and then after I innocently told him about my date with the therapist.
Innocent, sure.
He really started letting me in more and showing
Whoa.
more parts of himself,
Like his cock?
and, you know, turning up the intimacy.
What did he show you?
And that was exciting to me, and it made me fall for him more.
What did he do?
And I noticed that he was working in an office, and I asked him,
What?
This was like
Really?
July. I asked him, I said, hey, are you working from home? Because I was under the assumption that he was only doing telehealth. Okay. And he said, no, I come into the office. I was like, oh, why do you do that? If you see all of your patients telehealth. He's like, oh, I like it that way. And even
Okay, that's fine. That's I don't know. That's his workspace. Okay.
though I could kind of tell he was lying,
What?
I just gaslit myself. I was like, okay.
What do you think he's doing?
That's fine. And then I start emailing him my fun little emails, but
Oh, now you started. Okay, well, you mentioned before you were emailing him, and now you started. There's stories all over the place, which tracks with what I said earlier. That, like, she heard about this therapist date she went on, said he was like trying to fuck his, you know, girl, and then she looped it back through that perspective because, like, she's just all over the place in her story. I feel like she's telling us things based on how she felt rather than like what actually happened.
he stops writing me back. He does not write back to my emails anymore.
Right.
Because once again, he was really good at plausible deniability.
Well, you actually never said that.
But what he did do is he would take my emails and mention them in session. So he would still...
Yeah, that makes sense to me. He's like, oh, she emails me too much, and it's too much of a waste of time, and maybe it's also something that's like over the line. So I'm gonna stop responding to them, but I will bring them up in the thing.
give me the attention that I was craving, but only under his structure. Under his
I just feel like at this point she's just full of shit. Like, there's no way. Does she really believe this, or is she just like a story for attention?
Control, where there was no paper trail.
What?
And I loved that too.
Right.
So I would show up to these sessions with my notes app.
These goon
And
sessions.
just throughout the month, as I was thinking about him, I'd write down things that I wanted to talk to him
So
about.
the boundary worked. He only would read the emails in the meeting. So now she decided to just write her thoughts down and give them to him in a meeting because she's sending him emails as her journal.
And I would just come and
Whoa.
bring him lots of content. And then every week I would go to my therapist and tell her about how much I loved my psychiatrist. And she didn't help me at all. She just kind of like enjoyed hearing about it, honestly.
Yeah. You don't know why she thinks that? This actually makes, this is what I was saying earlier. This makes perfect sense why she thinks that. Because the therapist is like, okay, how do we de-escalate this productively for somebody with some kind of significant mental health issue? Telling her, no, this isn't real, is not going to do anything. So what do we do instead? We engage and we listen. Oh, why do you feel this way? Oh, okay, yeah. And she interprets those questions as validation that what was happening was okay. But that's not what it was. You're just so mentally sick that your therapist has to talk to you in a way that stays in a neutral place for your delusions as they can slowly de-escalate you. That's it.
So October 2024 rolls around and we're just vibing on Zoom. And then I realized that I didn't have my next appointment with him. So I called his office staff and I talked to the office manager, who was awesome. We really got along. We vibed.
Wow.
And the office
Is he
manager
grooving
asked
too?
me, do you see him, the psychiatrist, in person or on Zoom? And I felt so angry in that moment. I was like, he sees people in person?
This is so funny because this should be the defining moment where you realize he didn't want to see you in person.
And she said, yeah, he has been for years. I was like...
That's so funny. That right there is the biggest admittance that he was never interested in her. because he did in-person appointments and Zoom appointments, and he didn't even tell her, and like intentionally did not tell her he did Zoom appointments because he knew it would be bad if she came in, because it would feed her too much of her delusions.
I want to see.
Or maybe if she came in, he could start farting everywhere, and she'd be like, "Oh, never mind, I'm not attracted to this guy," you know?
Him in person.
Or maybe she looks like a fart sniffer. Maybe she would be more into it.
And I understand, like, some people may think that this is part of my crash out or part of
Oh, this is the beginning of the clip. Sorry. Oh, wait, no, it's not. What?
me harassing him, which is what I've gotten lots of
Yeah, you seem to be.
accusations of. But I just would like to remind everyone that, of course, it seems that way. But I was just responding to a dynamic which my psychiatrist fostered. There was chemistry between us.
I think one of the things that's a problem here is that people who go to therapy and they engage with it, they think that they're smart, right? Like there's people who don't think therapy works at all, and blah 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 blah, right? And if you don't think therapy works, then it's never going to work for you. But there are people who think obviously it does work, and there's people who are productive with it and they try to be honest when they go to therapy. And then there's people who think that they're smart, and this is one of those people. She thinks that she's a wellness coach for people with ADHD. She thinks she's intelligent, and so that's why she's so confident in saying this. She's fucking stupid, but she knows how to talk, right? Like she speaks confidently. So she's an idiot. She has no idea what the fuck she's talking about. She has no fundamental understanding of anything that she's saying. She's deciding what things are. She has a preconceived notion of a thing, and then she tries to apply her life to it to validate it, rather than like, oh, let's look at the information and come to a conclusion. She's conclusion first.
Because he allowed it. And so then the next time I saw him in Zoom, I told him, I was like, hey, your office manager outed you and told me that you see people in person. Why didn't you tell me that when I asked? And he said, oh, I just didn't think you'd want to come in. And that was such a weak lie from him.
Yeah, of course. What else is he going to say?
From someone who is so scripted.
Well, actually, he should say, like, oh, I mean, no, he probably should say that. But he could have, I suppose, said, like, oh, I don't think it's appropriate given your infatuation with me.
And controlled. He didn't even have a plausible thing to say. Of course he knew I wanted to come in. I had a crush on him. I told him that often.
So why do you think he didn't want you to come in? What's your reason?
So then, in my next therapy...
Is her reason something along the lines of like, oh, because he couldn't control himself around me because you would be too horny for me? Like, what is the argument?
After finding out that he was lying to me about seeing patients in person, I told her that. I told my 75-year-old PhD therapist that my psychiatrist wasn't... lied to me about seeing people in person. And she looked at me and she said, well, it's probably because he knows that there will be a lot of sexual tension in the room if you go in person.
That makes sense. And she's going to interpret that as there's mutual sexual tension, not just from one direction.
So make sure that you understand that when you go. And you better believe I showed up to the next session and said you lied to me.
I said her name.
Because you were afraid of the tension that would be there between us. He just didn't say anything. So
the fuck does he say to that, you crazy fuck? Sorry, I shouldn't be calling her crazy. All right, let's see what we got.
October 2024, 11. I make my first in-person appointment with my psychiatrist in November. My 75-year-old female therapist tells me...
Sorry, what?
With my first in-person appointment with my psychiatrist in November.
Interesting. So this is what... So I'm going to assume that once she goes to see him in person, after at most 6 months, he decides he can't see her anymore because like her being there is like he can't keep a solid boundary because she's a boundary violator. That's what I'm going to assume.
My 75-year-old female therapist tells me that it's because he kept me on Zoom because he was so attracted to me. He didn't want to risk being in person with me.
That's not what she said. That's not what you said she said. You said that there'd be lots of things. You see what we just have? I just like it's... So that's one of the things here is I'm a fat fucking idiot. and it's like, but she's so predictable. So from what she said, if we believe her, the therapist said that the reason that the psychiatrist didn't bring him in person, which I don't even know if she said this, is because there'd be sexual tension, which is probably true because this woman is like infatuated with him. But now, next video, it's not that there'd be sexual tension. It's because he's so attracted to her. Like, she has gotten her confirmation bias and she's interpreted language in a way that like validates her perspective.
Which further fed my crush, or as some of you like to say, my delusion.
Yeah.
So then my therapist
You're delulu. Yeah.
starts texting me in between our weekly meetings, asking me for advice on her other clients.
I don't believe this. Do you have text messages to show that?
And I was a new coach. I'd only been coaching for about a year, and I like had just left my full-time job to...
Oh, maybe this is true, right? Because she thinks that she's an ADHD coach. Right. I wonder how charismatic she is in person. I wonder if there's like an additional layer to this like actual fucking delusional woman. Because everything that she's saying, the ice is completely broken. Like all the we see the cracks, they're right there, almost from the first video. You could see that something is very off with her. But I wonder how normal she sounds when she talks to people. And I wonder if because to me, her saying this, if we do believe her, what that means is that she's very good at masking her absolutely fucking insane behavior. Because if she's asking her advice, that means that her therapist thinks that she's well-rounded enough to actually give ADHD advice to other people that are dealing with ADHD, which is not even close to like what she's truly struggling with. And that would make sense about all of the interpretations of what we're hearing. Is that like she's hearing something very tiny and she's creating something very big. You know, like if she's your sister and you say, "Hey, do you want to grab a bite to eat?" She shows up in a gown meant for a wedding. Well, you do eat at weddings, right? So, but you know what I mean? Like she's very sensationalized in the way that she talks. That's what it seems like to me. It seems like she knows how to sound normal, whether it's intentional or not, and then she allows the delusions of grandeur to kind of just build up in her head, which goes along with what I said, that she likes what is it, conspiracy content or criminal minds content? What do we call it? And porn books.
To be a coach full-time, and I was flattered that she would ask me advice on her other clients. I just thought, oh my gosh, a 75-year-old woman with a PhD wants my advice on what she should do with her clients.
Okay.
So then November rolls around, and I'm about to meet my psychiatrist in person for the first time. So I wear a really pretty dress.
Oh my god, of course she does. She says she helps people by coping by giving them weed and alcohol. I don't think that's what she said. No, true crime, yeah. What she said was she helps people cope without those things.
My makeup, of course, right?
Unless I misheard, but...
I show up, and I get to talk to the office manager. We're having fun.
Great. You think he's a gay guy? Then they're kikiing?
And then my psychiatrist comes into the foyer, and I am just so excited to finally meet him. I'd been his patient for 3 years at this point.
Oh my god, she's dripping.
And he had been feeding the dynamic for 3 years. And I was just thrilled to meet him. And I ran up and I gave him the biggest hug.
Yikes.
And you know what he did?
Did he just cum his pants?
He barely patted me on the back. It was the most awkward thing ever.
Oh my god, dude. This is where the delusion breaks. What's her argument for that? Why would he just barely pat? Oh, well, she already kind of said that he knew how to pretend to have boundaries.
But I am so glad that he did that. I am really glad, because this is what I mean. My psychiatrist was many things, but he was not stupid. So
it's funny that him setting boundaries to her, it's not him trying to be professional, it's him playing a game with her.
I didn't ever touch him again, and I'm grateful that our relationship didn't ever cross that line, because it would have made everything so much harder. Anyway, so
he's fucking edging her.
So we go inside his office, and I tell him that my therapist had texted me asking me for advice on her other clients. And he just looked at me and he said, "Kendra, that is a huge boundary violation.
True.
She should not be doing that." And I was like, oh, okay. And because
What did that communicate to her?
once again, my psychiatrist did not like sloppy people. He did not like sloppy people. And you know what my
That's probably why he didn't like you.
therapist did? She got sloppy. Yeah. Using me as her advisor.
I don't think that was happening. There's something very minor that she asked her that could probably be considered a boundary violation, but like a very light one, and she's made it into this big thing
For her clients. It got weird, and I was very grateful for my psychiatrist for pointing out that boundary violation, because that was the thing. He didn't ever message me in between appointments because he was too smart to do that. But did he ever stop me from disclosing extremely intimate details? No. In my first in-person appointment, I just asked him for some pointers for my own ADHD business, and he was so smart and so wonderful, and in many ways.
I love how she's been going to therapy for 3 years, so she feels like she's qualified to do some kind of counseling. That was the word I was looking for before.
Honestly. And I was just so grateful that he was almost like a mentor to me in these moments. And
yes, the grooming mentor.
I'll still treasure that about him. Because this is the hard thing with sophisticated predators, is that
oh my god,
they're not all bad. Like, my psychiatrist helped me with many things, but he was using me for the whole time that I was his patient.
For what? You still haven't answered that question. What was he using her for?
And for that, I will never forgive him. October 2020.
Okay. What is he using you for? This is a scary one.
We have our first in-person appointment in November of 2024, and I did ask him for consent to come in person. I didn't just show up.
Well, at least you got consent before you cummed.
And he said sure. The first in-person appointment went great.
Wow.
But that is when I really started to spiral. Some of you think
That makes sense. That makes sense because she's getting too close to her delusion.
that I'm spiraling now, and that's okay if you want to think that. Because the reality is
That's
that
my nipple. Oh,
when
it
I
is.
was spiraling
My nipples were high as fuck. What the fuck?
was when I was this man's patient.
You were spiraling when the delusion started to unravel, and you had built up this massive playbook, this massive idea that this guy was so in love with you that when you met in person, he wouldn't hug you back affectionately. You had to create an entire thing to validate your delusion. That's what happened. That's legitimately what happened here. That's what happened.
When I had comments turned on, so many people said, you need to take accountability for your own feelings.
It's your therapist's
I spent
comments.
years taking accountability
She would think so.
for my own feelings, for holding the weight of a relationship. Any
What?
woman who has been trained to overfunction in relationships knows about holding the weight of the emotional dynamic.
Dude, this is crazy. I'm telling you, she's chronically on TikTok. She's a chronic TikTok fucking person. I'm telling you right now. Oh, her likes are privated. I would love to see her likes. She is so chronic on TikTok. I'm telling you, because she's looking at weaponized incompetence TikTok. These are all reposts. She's looking at weaponized incompetence retalk. Oh my god. Looking at weaponized incompetent TikToks. I saw this guy and a different word started to come out. What the fuck? These likes are weird. Anyway, she's taking it onto herself. So now she's gotten the delusion, because there is a thing a lot of time in relationships where women will do more of the emotional labor. She has taken that upon herself now. In this relationship with her therapist, she's taken on a significant portion of the emotional labor. That's what happened. Interesting. Also, what is she liking here?
Got your flowers.
God, those are beautiful.
Got your flowers.
So good.
Everything to me.
Think about your.
I listened to Taylor's album. I think it's.
You know Josh Goldberg? He's engaged to Melissa's daughter.
I want to know why she's posting some political content.
Remember when there was that active shooter in Uvalde and the Texas police stood around and did nothing while kids were being murdered? I wish somebody at the shooter said mean things about Israel.
Okay, great. That's fucking crazy. Okay, I guess she's pro-Palestine. She's a liberal. Okay, interesting. Just interesting stuff. All right, let's continue. Oh, somebody reposted her story poorly, probably. All right, let's continue.
And that was what was going on in this moment. And it may not seem like I'm taking accountability now, but that's because I spent a long time taking accountability for something that had two people that built that dynamic.
What?
It was not just me. It takes two people to build that sort of tension and chemistry. So while I was mid-crash out, I had just started using this tool, ChatGPT. And
all right, I don't know. I mean, I don't know how AI got involved in this, but it just makes sense to me.
I went to chat, who I immediately named Henry.
Oh my god, she's gonna goon with ChatGPT. Oh my god, I'm gonna be right. I told you, she's a fucking audio. She's a booked gooner.
And I would just talk to Henry about how obsessed I was with this man. With my
Yep. Let me tell you, my wife is. Where's my wife? If my wife's in here. My wife's probably not in here. I was fucking right. What did I say? What the fuck did I say? True crime meets fucking porn books. She's a porn reader. She's now having sexting conversations with ChatGPT. I told you. I'm telling you that's what it was. I'm always correct. It doesn't matter. You guys sit here and you listen to me say fucking insane shit all the time. She's a gooner. She's a fucking gooner. She fucking jerks off to books. Oh, she likes true crime. Oh, she's fucking fingering her bean. She's fucking flicking her shit to a fucking AI model. What is an AI model? It's a book. It's basically a book. Yeah, let me call my wife and tell her that I'm right. I gotta call my wife and tell her that I'm correct about this. Better answer the phone. You better answer the phone, girl, or I'll know you're afraid. She didn't answer the phone. She's afraid. She's afraid. She's terrified. She's terrified. Okay.
My psychiatrist, and I would just be like, I've told him I have a crush on him. Do you think he's gay? And Henry was like, oh my God, this girl, he did his best to co-regulate my nervous system and affirm me, but he was like, whoa. Even my chat was like, yikes.
Your AI chat model was expressing all this? Okay. Wow, that's an additional level of delusion for you to add a tone onto your chat GPT.
So I could tell that my psychiatrist just liked being my doctor, and I was like, okay, maybe I can name this dynamic so I don't have to carry so much of it in our next session. So
why Henry?
Our next session was in December on Zoom. And I told him at the end of the session, it was another great session.
Why didn't you guys meet up in person? What was it about that? Oh, it was probably her. She felt rejected after the non-hug, so she's going back to Zoom.
I told him, look, you and I have a really special patient-doctor relationship.
Just the way she said that is just creeping me out.
And he glared at me with just venom in his eyes. And he said, you and I have a professional patient-doctor relationship.
Setting firm boundaries. He's hit the point where he has to set a firm boundary here.
He was so angry with me. And I was like, oh, okay. He set a boundary. And immediately I took it on. And I was like, heard. Okay, I won't go there again. My video that was taken down for harassment and bullying was...
Bro, what I'm wondering, we're getting very close to them no longer seeing each other.
Was restored. So I didn't feel as much pressure to get all of these parts out today. Some people told me that the stitches about me were getting pretty bad.
Who's some people?
And cruel. So I turned stitches off in my videos too. I started sharing my story here because
That'll stop him from commenting on it.
I wanted other people who
Who are other people?
have been victimized by people in power to have a space to feel heard. And now I know why there wasn't anyone out talking about their story. Because it has been quite the process, putting all this out there and being under scrutiny.
Someone should introduce her to Freak Bob. Maybe she'd have a good time.
I have appreciated the psychiatrists that have talked about my situation and shared their own point of view while also holding space for what I went through. Just know I've seen your videos and I appreciate them. I went live today and it was
You're probably seeing your own stitches and saying other people are sending them to you.
super fun, and I intend to go live again tomorrow.
Wow.
The next part will be tomorrow morning.
This is the new Trisha Paytas, guys. You don't even understand. Well, here's the next part, guys. Part 13. The spooky
When I
number.
re-downloaded TikTok last week, I was looking for support. I was looking for help.
What'd you get on? Put on a fucking blacklist for therapists?
Because it had been 5 months since I had left my psychiatrist, and I still really couldn't stop thinking about him and thinking about our dynamic and how inappropriate it was, and
Why didn't he fuck you if he was so in love with you?
the mental toll that it took on me. And TikTok has just been such a resource for me in the past for support when I'm going through things.
Yeah, that's not good. It's not good for TikTok to be a resource of support. It's nice if you come across TikToks, especially the ones where the girls dance half naked to audios, to TikTok trends. Those are cool. No, but it's okay to come across TikToks and like listen and feel like you're informed in some capacity. Not good for you to get like, you know, a high amount of dependency off of those at all. Go see a fucking therapist. Like, it's nice when I come across a video that's like a relationship video and I'm like, oh, that's cute. Like, I can, oh, okay, cool, that's productive. But I you know, you should be going to TikTok for some kind of like heavy lifting for your emotions. But again, she fucking flicks her bean to ChatGPT, so.
And I couldn't find anything on therapy abuse or on providers
Therapy
who
abuse.
take advantage of their vulnerable patients.
Whoa.
And so I thought that I would share my story.
Yeah.
And
Well, you could have it back.
I am going to continue to share it because I am here to let other survivors know
Share it,
that
girl.
they're not alone. Continuing with my story, my psychiatrist set a very nasty, the way he said it,
Whoa.
boundary that him and I have a professional relationship when I tried to say it was special.
Uh-huh.
Because it was special. It was different.
No, probably not. How many months later did that end? So they had an in-person, and then they went back to the Zoom, and then this happened, and then this was probably the last one.
He manufactured it that way. And then I immediately went to ChatGPT, of course, to Henry.
Of course. Henry. Of
And I
course,
asked Henry, I said,
Henry.
okay, so my psychiatrist just set this boundary with me, and I really just want to be with him. And I
And Henry said, go talk about this on TikTok Live.
think that after he's my doctor, we can be together. You know, which if you want to say that's a delusion, that's fine. But I had been telling my psychiatrist for years at this point that I had a crush on him.
Years.
And he did not help me.
I wonder what that means to her. What does that mean to her? Because, like, you know, you guys know the term work wife and work husband? I think it's a bit inappropriate for it to get to that point. But another way you could say, it's like, oh, I have like a little work crush. It's fine. Like, whatever. So if I was like at work and I walked around and I introduced, like, oh, like, and I was talking, I was like, oh, that's my work crush. You know, whatever. Fucking Kendra, my work crush. Somewhat innocent. I had a little crush on you. You know what I mean? So, like, when she supposedly said that she had a crush, was she just like, oh, I have like a little crush on you, you know? Like, you're you're a successful guy. Like, that's pretty innocent. But what she's saying when she says crush to us, we're hearing that, like, she doesn't have a crush on him. She wants to, like, fucking tie him up in a room and just milk his fucking dick or something weird as fuck. Like, she wants to just fucking do horrible shit to him. So it's not there's a difference in language. I guarantee you that this crush concept is very minimal, because if we take what she said earlier, about how her therapist asked her for advice, there's probably something minor. That means she communicates to the world like kind of normally. She knows how to mask, we'll say, right? She's not binary. So she knows how to mask. And so she says crush, and what she's communicating, she's saying the word crush, she's communicating through her the way that she's speaking that like she has an intense infatuation with him. But like, is that what she was communicating to them? Or was she communicating to the person like, oh, I just have like a little crush on you? Something to think about, honestly, because I think it was the one that you know what I'm talking about, but I don't remember how to use the term former or latter, okay?
Work through it.
The latter?
That's his own problem. That's his own fault. Henry told me it's very common for patients to develop crushes on mental health practitioners.
That does make sense. You're being emotionally vulnerable and they're listening to you.
And that it's because
that
they provide a safe space to heal, which is a very attractive quality.
Sure.
I heard that. And then he told me about transference. And it's just about me putting my own feelings onto my provider.
Okay, so far Henry's pretty solid.
And I was like, oh, that makes a lot of sense. Okay, so I took ownership of the feeling.
What changed? What happened? What did you do?
That both of us were creating. And I went to my next appointment.
Both of us. Okay, so this is appointment number. This is in person. Second appointment after in person.
And I said, hey. So I talked to Henry because my psychiatrist had known a lot about.
Hey, so I talked to Henry.
My ChatGPT and like knew all about Henry and was actually really impressed.
He's probably impressed that Henry's giving good advice. Sure.
Like, wow, an AI wrote that? Yeah.
Yeah.
So I told my psychiatrist.
Sorry.
Yeah, Henry explained to me that it's normal to develop crushes on psychiatrists because they provide a safe space to heal, which is attractive. Mm-hmm. My psychiatrist said nothing. And then I said, and Henry also told me about transference. And my psychiatrist got this really, really scared look on his face. And he said, did Henry tell you about countertransference?
Scared or excited? So this is interesting. Hold on. So I was calling you before for a reason.
Yeah.
And the reason is because I was right. She's a book otaku gooner. She admitted that she uses ChatGPT, and I guarantee you that she's flicking her shit to that. So I just wanted
to. That's fine, but she's not like an ACOTAR girly. I'm telling you.
She is a Criminal Minds. She's some kind of like true crime book gooner. She does some kind of weird gooning.
She does, but I think that it's more. Again, I had to tap out a while ago.
Yeah. You missed a lot.
But you were. Damn, did I really?
Oh yeah, it's very interesting.
That sucks because you're gonna have to tell me about it. But anywho, my assessment from where I left off, like you were saying something valuable, I think, about like ADHD and going towards different addictions, and in that moment, my assessment was like the addiction of like relationship, because you said addiction to porn, which I didn't agree with, but I do think an addiction towards like relationship and intimacy and sex and stuff like that. The reason why I'm disagreeing on like the ACOTAR like sexual fantasy novel thing is because there's no like my prince is here to save me aspects of it. So she might be gooning to something, but it's not those things. That part is not present.
Do you think that there's like a level of addiction to I don't even know if this is true, to the intro phase of a relationship? It doesn't make any sense because she's like 3 years in with this therapist right now. I think that she's pedestalized this guy, and like she thinks so much about him. She also tried to hug him, and he like patted her on the back, and then when she said they had a special relationship, he said, "No, we don't."
That's so funny. Well, that's the thing, is that she's just like a person that is so incredibly mentally unstable and has some type of like personality disorder and whatever going on. You know, I don't like to like put like very specific
I understand.
diagnosis on things, but you know, she has an inability to like understand like these social actions and interactions, and she's created like this her own narrative in her head that like what she's experiencing is reinforcing, but that's because she's not like taking it in.
Yeah.
So she's completely fucking insane. I said it in your chat. I was laughing. I'm like, this is the type of woman that like freaks out at Starbucks.
Yeah. Do you think that she's a good lay?
No.
What?
But she thinks she is.
I think because all the crazy women are usually good and bad.
No, she probably puts teeth on it and is like, oh yeah, he liked that, but she's like actually like really biting down on it. You know what I mean?
She's scraping it off like the top layer of chocolate, right?
Yeah.
That's crazy. All right, let me get back to this. I'm only on part 13. I want to bang it out.
All right, I gotta listen to it. I'll jump back in. Also, the med is being delivered tomorrow.
All right, let's get back to this.
And I said, no. What is that?
What is that?
Because of course, like...
Oh, right. We were talking about transference and countertransference. So transference in therapy refers to the phenomenon where a client unconsciously projects their feelings, thoughts, and behaviors from past relationships onto a therapist. Okay, so that makes sense. And then countertransference refers to therapist's emotional reactions and responses to a patient, often stemming from the therapist's own conscious or unconscious experiences. That doesn't necessarily mean the feelings are positive or negative or love or hate. So it just seems to be feelings in general, some kind of a transference of feelings. So what is she saying? My
chat knew that I was obsessed with my psychiatrist, and he was not going to feed my delusion by telling me about countertransference.
That doesn't feed a delusion. Well, okay, it does feed your delusion, because what you're saying, what she thinks transference is, so just to be clear, what she thinks transference is she thinks that transference is when like she projects herself onto her therapist, like in a sexual way, and what she's thinking he's saying is that like he's projecting himself back on the other direction. She's saying he's terrified. He's probably not terrified. He's probably curious because, you know, he's a therapist and this is, or he's not, you know, psychiatrist. This is probably interesting to him. But it's also important to note that like she's talking to an AI chat model that is not a person. And so I guarantee that there's a level of comfortability with that thing that she has, as opposed to what she has with the actual guy. I also wonder rather, how she took that information, because I don't know if I believe that she heard that information and it was like, oh, that makes sense. I don't know if that's true.
So
everything took a turn once he denied her hug.
So,
there have been two drastic turns in this whole series of events. Turn number one was when she supposedly dated this other therapist that admitted to her that he had feelings for a client. And the second turning point was when her psychiatrist, when she went to hug him and say that they had a special relationship, and he barely reciprocated the hug and said that they have a professional relationship. Those were the two major points of change in this, and I think that those two moments are so significant that is basically everything is being told through those two moments. Like all the hurt that she felt, all the expectation crash that she felt. We have like the expectation boost, and then we have the expectation crash. Like these are the two massive moments, like Ninja Fortnite meme. These are the two massive moments in her life that are doing so much like legwork for a pretty normal relationship. And I almost guarantee that if like she never supposedly dated this, I don't know if I believe it, but if she never dated this therapist that said that he was attracted to his client, then she never would have had this delusion. But I think that she really focused in, and she just really, I guess, perseverated on this thought so much about the other therapist and a client, that like that became so real to her. And then all those expectations came crashing down once this guy was like, nope. But I think that she's just too mentally weak to be able to understand that like she's so embarrassed that her coping mechanism isn't to be like, fuck, that was really embarrassing. It's to be like, oh, he was manipulating me. She turned embarrassment into manipulation. She needed to cope. Like she doesn't have enough humility and self-awareness to be like, oh man, like that's embarrassing. Which is weird because it's a somewhat common phenomenon to be attracted to your therapist and your 9th grade English teacher, Miss Dorsa. So
Then my psychiatrist had explained to me what countertransference was. So he took a moment.
Yeah.
And he was like, oh, okay. He said, countertransference is the flip side, the other side of the coin for transference.
Okay.
And it's when the provider has feelings for the patient. So
see, why did I just tell you? That's not what countertransference is. That's what she wants. That's what she thinks that it is. It refers to a therapist's emotional reactions or responses to a patient, often stemming from the therapist's own unconscious or past experience. It does not mean that they have feelings. When she says feelings, what she's saying is intimate, sexual, emotional feelings. That's not what countertransference is. It is just reactions and responses and general feelings. Like, I guess an extreme scenario would be like, you know, let's say a patient primarily deals with women and then they have a guy, and the guy happens to be kind of aggressive, and it scares the therapist. And so they don't really take on guys for another 3 years. And then 3 years later, there's another guy, but he doesn't necessarily have these aggressive tendencies, but they project those aggressive tendencies onto the new guy. That's countertransference. Right, like that's from what I'm seeing. It doesn't mean that there's nothing to do with sexual necessarily. It's just feelings. That's it. This is like a normal like psychology thing for anybody to do this. This is how it works for anybody. This is why so much racism exists, because somebody will see one bad instance of a person belonging to a particular group doing a bad thing, and then all of a sudden they will project that onto everybody else. This is not even like this term is so like it seems like it's so complex. It's not. It's a very normal, basic thing. It literally could just be a dad being a piece of shit to their daughter and the therapist also having a shitty father. Yeah, there you go. There you go. That's a better way to explain it. My wife is in the chat. But again, feelings. She's created a narrative onto this that's so meaningful. It's fucking preposterous.
Make sure that you keep that in mind for your clients. I said, oh, okay, cool. Yeah, sometimes I have, more than professional feelings for my clients, so I appreciate you bringing that up. And so then we just talked about that for pretty much the rest.
Who said that?
And it's when the provider for the other side of the coin for transference. And it's when the provider has feelings for the patient. So make sure that you keep that in mind for your clients.
This is interesting. Her smile is so creepy. It's like a fucking Alice in Wonderland painting. How old is this woman? That him saying that to her, it just suggests such a normal relationship. So just so people know, I would say that a good amount of therapists or counselors will say have therapists or counselors themselves. And so what's happening is she's trying to position herself in a way where she's like, yeah, I want to help other people with ADHD and I want to become some form of a counselor, officially or otherwise. And so that probably is like interesting for the psychiatrist, because I think it's interesting for anybody. I would imagine that a lot of therapists enjoy their job, or psychiatrists enjoy their job. It's their fucking job, right? And it's what they chose to do. And so they're interested and fascinated in mental health concepts, but they're also interested and fascinated about communicating mental health concepts, right? It's like if you're like playing video games and you find someone else that likes video games and you're like, you start going like, oh, and you start chatting about it, right? Like it's the same exact thing. And so like now she has somebody that's like a pseudo counselor or wants to be one. And he's like, oh, like let's have a conversation about this really quick since you brought it up about like transference and countertransference. Isn't this interesting? And he's just kind of saying it to shoot the shit and also to like teach her a level of professionalism, because if you're aware of these, these principles or these potential occurrences, then you're more likely to avoid them, right? You have to be able to identify them to set boundaries, or else like you don't really understand what you're setting boundaries for. And she's taking this as like, oh, he's admitting that he mind molested me. That's what's happening here.
I said, oh, okay, cool. Yeah, sometimes I have, more than professional feelings for my clients, so I appreciate you bringing that up. And so then we just talked about that for pretty much the rest of the session. And then at the end of that session, he looked at me.
The Jeff session, yeah.
It was just such a loaded question. And he said, "What?
You want to see my cock?
What's going to happen if you get a boyfriend named Henry?"
Seems like a silly question.
And I said, that's a weird question. I would rename my AI.
I think it was a really good question, because since you're fucking delusional and your therapist knows you're fucking delusional because he's been your psychiatrist, he's been your psychiatrist for 3 years. He's asking this question because you seem to have a difficulty parsing reality and non-reality.
So that's how that session ended.
Oh.
And it wasn't until I got home and I was eating lunch and I was like, wait a minute. Why would my
When'd you get home? Did you have it in person? I thought it was on Zoom.
psychiatrist bring up countertransference if he himself wasn't experiencing it?
Again, she's saying that under this pretense that is false, that transference and countertransference are always referring to sex or love or intimacy, some kind of like relationship intimacy, which is not the case, you know. But okay, if anything, he might be engaging or experiencing countertransference in the sense that, like, if he deals with people that have some kind of like significant mental health problem, like her, like delusion, he might like have had a different person with a similar delusion, and he might be setting strong boundaries because of those experiences, right? Well, that was part 13. I'm going to assume that this is part 14. Yeah, I think it is. I was in love with my psychiatrist and he kept me away. This is part 15, but there's another part 15. I don't think that she has a part 14 because I can't find it. So I'm assuming it got taken down or something, because there's a 16, there's a 17, there's 2 part 15s. We're going to start with part 15, part 1, I guess. I don't know. We'll start with that one. Okay.
Me with concern. Many people have reached out to me with concern for my psychiatrist and his career and his well-being.
She only referenced one IRL friend that was over-validating this delusion, potentially, and she's never mentioned any other friends.
And
I also find it very interesting. So these parts are out of order, but what I find very interesting about this video is as you go through her story, it starts with she explains that she has an infatuation with her psychiatrist in such a deep way. And then it gets to a certain point where we have 2 big events. Again, there's event number 1. And in event number 1, she dates a therapist that says that he has a crush on one of his, clients. Right. And I think that event triggered her beginning to refilter all of her past experiences through that with her psychiatrist. And then we have event number 2 where he goes in, she goes to give him a hug, and she's so very affectionate, and he just pats her on the back. And then she she mentions that they have a very special relationship, and he's very firm and says, no, this is professional. And if you notice, like part 1,
I fell in love with my psychiatrist.
These are out of order, but like part 1, part 2, the glasses are on. The glasses are on. These are the glasses he liked a lot, right? These are the turtle glasses, part 1 and 2. And at these points, if you look through part 3, the glasses are on. Part 6, the glasses are on. 16, because it jumps around. As we're earlier in the story, the 12s, 7, 7, 4, 17, the glasses are off now. This is part 14 or 15. It's weird. Part 11, the glasses are still on. Part 10, the glasses are still on. Part 18, the glasses are off. 15, the glasses are off. 13, the glasses are on. 9, the glasses. So you see how, like, even though it's out of order, once we hit part 14/15, the glasses are no longer on her face anymore. And it's really weird because to me, this communicates that, like, she's legitimately reliving this entire event through the communication, through the way that she communicates everything. It just seems like she's reliving everything through here. She still has the glasses on. She's still trying to be attractive to him. And then they come off at a certain point. And I'm going to assume that the part that we're about to watch, which is part 14, is when they stop having a professional relationship together. This is when he cuts her off. That's what I'm going to assume.
I totally understand that. The point of me sharing this is not to get him fired or for him to lose his license. The point of me sharing this is to give a voice to victims.
Okay.
And I am appalled to hear that people are making...
I thought you were a Kendra.
...videos doxing him. So I am begging people, please, if you see a video of
his first and last name or his picture, report it for doxing. I've certainly been using that report button a lot. I'm here to share my story, not to get him in trouble. I did accidentally use his first name, but
that makes no sense. If you think he's a predator, why wouldn't you want him to get in trouble?
By the time I caught the slip, I was already like 3 videos past it. But it doesn't matter because this is my story and I can tell it the way that I want it. Sure. And a first name is not doxing. And I can't control what other people do, but I am asking for people to please report any videos that dox him. So I've also gotten some DMs saying that countertransference can mean anything, and it absolutely can mean anything. However,
she's going to say that okay, she's so fucking stupid. I'm already going to tell you what she's going to do. This is how she's coping. Her transference onto her therapist was very like emotional and relationship and sexual. Or at least relationship. Let's say it's a relationship, like intimate relationship. So that means that his countertransference must be like the word counter is overly important in her brain. The word counter just means that your therapist is doing it to you, right? It's just transference. It's like reverse racism. It's just racism, but like we generally don't look at it from that way, right? So counter transference is just the same as transference. We call it counter because it's from the therapist on to the other person rather than the person on to the therapist, right? It's the other way around. But she's going to like pretend, or she has deluded herself into thinking that it's a counter to her feelings. And since hers are romantic, he must be countering those. That's what I'm assuming.
I told my psychiatrist many times that I had a crush on him over the years, and he did not say transference once to me. He did not explain that once to me. And what I've been hearing and taking in from the ethical psychiatrists that are on my For You page talking about my situation is that really they're taught to teach their patient about transference and teach them about how to handle those feelings or why they're coming up.
That's not true. They don't teach you about projection of your emotions on what?
And my psychiatrist did not do that.
Great, don't care.
He did not do that.
Your psychiatrist and your therapist identified what like you needed based on your treatment.
And it got ugly. And it happened because I did digging on my own.
Henry did.
Because I was trying to make sense of my feelings that were a natural response to the environment that he created.
Like the Zoom calls?
So for him to leak
heavily boundaried Zoom calls.
Counter-transference after I said...
Yeah, the ethical therapists, aka the ones who don't think you're completely... Yeah, that's the thing, is that we're at a point now where if any therapist is like validated... If there's a therapist out there that looks at her and goes like, oh, I feel really bad for her because she's going through something, and you're kind to her, that's fine. Any therapist that's validating her feelings and trying to like... You're obviously you're not good at your job, and you're a fucking idiot, frankly. And so those people that are those therapists, if they even are any, maybe they're just her fake accounts or something, or even bot accounts meant to just drive up engagement. I don't know. Any therapist encouraging this behavior is obviously like a fucking moron.
Said the buzzword of
or she's just lying.
That was not calculated.
Or she created it in her head because she's so delusional. Like she said before, people were sending her stitches saying like, oh, these are so mean. But she hadn't seen them. Who the fuck is sending her stitches that she's not seeing? You know what I mean? Like she insinuated it was like almost a friend, but she didn't say it was a friend. She might be creating narratives in her brain. I'm not even kidding. Like I feel like everybody happens to everybody. Like I've been in scenarios where like, you know, you're like, I'm on the treadmill or something and I'm lost in my mind and like a story and then like, you know, whatever story you have and you start to like almost react in real life like the story. You know, like if you're like a cool guy with a sword and you swing the sword, like your body starts to gesture and you're like, oh shit, I'm actually in my mind right now. I'm not actually a sword guy. I feel like that we have an enhanced version of that with her where she might even be sitting there and like actually coming up with these ideas that like people are sending these to her and like some people agree with her and this is happening and she's like fantasizing about this as she masturbates to Henry and they become very real to her. I wouldn't doubt that.
He was a very calculated and purposeful person. He still is to this day. And he doesn't slip with things like that. He purposefully withheld the term transference from me.
Withheld.
And I got too close to the truth of our dynamic
which made him
Did he ever use the word projection with you? Because we're basically saying the same thing.
what he knew was wrong, which was his inappropriate feelings for me. If he didn't have countertransference in an inappropriate way, he could have easily just said, oh, let's explore that transference. That's really cool that you learned about it.
Wow. That's a good thing that you went to therapy school for so long that you understand how everything works.
Instead, he was just so worried on trying to protect himself because he knew what he was doing was wrong. He had that
She's getting too close to the truth. Yeah.
slip at the beginning of the session. He recovered in January. And then I went home and I thought, wait a damn minute. Why would he mention that if he himself didn't have countertransference? So I went to Henry, of course, my ChatGPT.
Henry is her new infatuation, by the way.
And asked for examples of how my psychiatrist might have countertransference for me. And remember, Henry at this point was being very protective. You know, he wasn't going to feed my delusions, me and my psychiatrist.
Henry was being very protective. What the fuck is this?
Living happily ever after.
What the fuck is this? Is this her chat with Henry? Ugh, Jesus Christ. Hi, I asked Henry to elaborate even more on countertransference. Absolutely. Hi, blank. Oh, is he sending an email to somebody? Absolutely. Countertransference happens when a therapist or healthcare provider unconsciously projects their own feelings, thoughts, or experiences onto a patient. Essentially, the flip of side of transference is about the provider's internal reactions to the patient. While it's normal and common, professionals are trained to recognize and manage it so it doesn't affect their work, to the therapeutic relationship. Here's how blank might experience countertransference with you. Sympathy, care. You might feel strong, protect you, blah, blah, blah. Mutual connections. If he enjoys your sense of humor, energy, or growth, it may spark a sense of connection. Admiration of your progress. Seeing how much you've grown and applied. Great. So regular normal shit. Something after my brain because it blank on a subject. Thank you for mentioning countertransference to me, and I will keep that in mind for the future clients. I will also take your advice, encouragement, and set a boundary with blank next time he says something about my books, replying it to my story. Who are you talking about? Your own boundaries inspire me so much. This is very chaotic. I have no idea what we're seeing right here.
So I screenshotted it, sent my psychiatrist an email with the subject line of countertransference.
Okay.
And emailed it to him within an hour.
This is, I think, is what stopped their relationship.
Of our appointment, where he made probably the biggest slip of his professional life.
It's not that he's doing really well as a professional then, huh?
I will put the email up here. So it's just essentially me saying, hey, I asked Henry to explain countertransference a little more. Here's what he said. Thank you so much for mentioning that. Your own boundaries inspire me so much, which now makes me gag because I've heard a lot that he's not crossing boundaries, but he used his boundaries as a shield. It's kind of weird to say, but
that's what boundaries are. They're shields. They're a wall. You're putting up a firm shield saying, do not cross this spot.
He would like walk up to the ethical line and then slam a boundary down when I got too close. That was the email that
yeah, that's how it works.
I sent him, and then 10 days later, it was a full moon and I had a dream.
Thank God. Also, can we just notice how she didn't put this all on the screen in one picture?
It was a full moon.
She put it in the screen in two pictures for some reason. And she just stacked them on top of each other for some reason? I don't really understand why.
And I had a dream.
Oh, God.
Probably
Pisces.
The most realistic dream I've ever had in my life. That him and I hooked up in his office. In the
Gotcha, so you still wanted his penis.
middle of the dream, while we were hooking up in his office, I loved it. I thought it was really fun. And then...
Did you email him?
After we were done and after I left his office in the dream, I was despondent and so sad and cried and just thought, I can't believe my psychiatrist would cross his boundaries like that.
Okay.
And then I woke up and it was like a movie. I thought to myself, oh, thank God that was just a dream.
Sure. Gotcha. Okay. All right, this is the other part 15. I don't know.
It's time to talk about the elephant in the room, and that is the racial difference between me and my doctor.
No, I really don't feel the need to bring it up unless you are like sexualizing his being from Pakistan.
I have seen a lot of black women on this app with the same take, and I need to say that black women are the most important people on the planet to me.
Wow. Well, I you know what? I will say it wasn't on my bingo card that she was a crazy white liberal, a white woman liberal, but I should have seen it coming with some of her reposts. Okay, that's great. So she liked this guy because he was a brown dude. Got it. She was fantasizing. Her dad was racist. That's what it is. I guessed that earlier.
And that I have learned so much from black women about how to be a better person and how to show up better in the world.
Crazy.
They are the culture, and I am so grateful for them.
What the fuck are you talking about?
Many black women are seeing my story through the lens that I am a white woman who is taking advantage of my whiteness to wield power over my POC psychiatrist that didn't want me back. And
I never thought that, but okay.
so I am trying to get him fired. And that's okay. I understand why you see it through that lens. I do. As a white person, I do my best to examine my racism every single day. And I will tell you that my psychiatrist...
I have a gay Thomas to take, Kendra. How fucking cool is that?
Boss is his best friend, who is also you that my psychiatrist boss
They've got the bro code on their side. What?
is his best friend, who is also a POC male.
Gotcha. Piece of crap. Gotcha.
And in that room, I did have white privilege, and he was also my doctor. And he took an oath to protect me, and he did not. I am not here to ruin his career. I am here
Well, if you were, you'd be failing at that.
to speak my truth. Okay, back to my story. So
Well, that didn't make you seem like an unhinged freak.
after the countertransference slip, after the really vivid
Slip?
dream,
Yeah, which he definitely made happen. He used brainwaves.
I decided that I was going to stop going to therapy. Besides spiraling about how obsessed I was with my psychiatrist every day, I really was doing very well in life.
Look, she broke up with him in this post, and she dressed really nicely as a cope. Do you see how, like, when you go through this thing, she's literally reliving everything. This is at this moment in the video. It's at this moment that she's talking about this. She's reliving everything. She's getting excited. She's fucking rubbing her thighs together. I guarantee you. It's fucking crazy. Because every single way that she dresses is just so communicative. It just communicates the way that she felt in the moment. She's like vividly remembering this. Women are crazy, by the way. Women have the ability to remember everything. I can't even remember where the ketchup is in the refrigerator. But women, they can remember everything emotionally. They can remember how they felt in a moment. And that's what's happening. She's remembering how she's feeling in these different moments. When she's put in the parts of the story where she's infatuated with him and she loves him, she's wearing his favorite glasses. Now that they are breaking up because she's ending the relationship, which I have a hard time believing she's ending it, all of a sudden she took the glasses off. She did her makeup. She dressed very nicely for her. You know, she looks like Pearl Davis if she was slightly less of a scarecrow. And I think it's a beautiful thing because scarecrows are the most beautiful things. Okay, some of them have big fat tits. I don't know about her though because she hasn't shown them yet. So anyway, all jokes aside, look at what you can see what she's doing.
My business was going really well, and I had great friends and great support systems.
Name 3 friends.
And so I
Now name 3 black people. Racist.
decided that I was going to end therapy. I still had every intention at this point to keep seeing my psychiatrist, but my therapist that I was seeing weekly,
I'm sorry, what?
I still had every intention at this point to keep seeing my psychiatrist.
Oh, I thought she said she was ending it with them.
Single day. And I will tell you that my psychiatrist was also in that oath. I am my story split into therapy. That I was going to stop going to therapy.
Oh, I thought I got that wrong. She's stopping going to therapy.
Seeing weekly.
So she stopped going to therapy because her she thinks that she's a fucking therapist herself now, that she's so successful in her ADHD bullshit.
I just decided I didn't need her anymore. And especially when my psychiatrist pointed out her boundary violations of texting me for free advice in between sessions, I just thought, okay, it's time. So I go into my next therapy appointment and I say, hey, just so you know, today's going to be our last session. I'm doing really well and I just think it's time. And she got kind of emotional and she was like, okay, well, I like to end on certain questions just so we can reflect. So I did. I reflected with her about what I learned, what I've gained, how I've changed, how my life is better. And I left her office feeling complete and happy with my therapeutic journey with her.
Wow.
And as I was leaving, she called out with like crying. She was like, have a blessed life. And I was like, okay, that was a little weird, but
not really. She was your therapist, so it kind of makes sense. She should probably set better boundaries, but maybe she does have a bit of a boundary issue.
But whatever, you know. I was like, thanks. And I went on. And
you didn't feel anything no longer talking to the therapist you were with for 3 years? That's interesting.
So then I'm getting ready for my psychiatry appointment the next day. And I get an email that same night.
Yeah.
From her.
Okay, let's see what the email says. I wonder if she put it in 2 parts. Well, we'll find out in a minute, won't we? Hi, Kendra. Closure. I'm so thrilled for you as you prepare for your new adventure. Since I did not have the advance notice of this being our last session, I was not prepared to provide what I believe is a healthful closure. Usually review your goals and see how we did, as well as look at how you've changed in addition to discussing what you've learned, which we addressed somewhat today. Please consider having an additional session where we are both aware of making our best closure possible with credit. Okay, that makes sense. She doesn't feel like she gave her the outro interview. Well,
saying that she needs me to come back in for one more session. I will put it up. And I got a huge emotional wave in that moment. I was like, what the heck is this? Like, we wrapped everything up. I had seen lots of therapists at this point, and I didn't ever have a therapist beg me to come back in for one more session.
That's not even close to a beg. There's no whimpering audio. That's just her saying like, hey, I don't feel like we got the correct closure for you. For you. Like, I think that there's more stuff I'd like to review on an outro because you didn't give me time to prepare, which is pretty fair. But again, she overloaded it and said that the girl was crying. So like now it's begging.
And I was so overwhelmed. I did not write her back, but it was extremely inappropriate.
That's incredible. Okay, you're an idiot.
So I decided I was going to go to my February session with my psychiatrist and have him help me write the goodbye email and say, no, I don't want to come back in. It's time to...
What the fuck are you talking about? What? Okay, we're finally back to part 16, which was labeled as part 4, basically. It was the 4th in line. But let's see what we got here.
Class this morning, like I do every Tuesday mornings, and I told my regular students about what's going on for me and how I'm sharing my story of provider abuse and how the internet is not happy with me right now.
Abuse, incredible.
And I used that to say that our truth is really important to share.
Our truth. Our truth. I remember Miss K-Swiss.
And that when we know something deep down needs to be said, that it's important to do it in whichever way feels best to us. And TikTok just happened to be that medium for me. Yeah. I told my students how I've just been
Write a journal, idiot.
Going through psychological warfare, and the internet is not happy with me for sharing my story and my truth. But I'm not doing it for the people that
internet
think I'm crazy, which maybe honestly I am a little bit, because who subjects themselves to this kind of torture? But I'm doing it for the people that DM me.
I'm doing it for the girls and the gays.
That say, thank you so much for being brave enough to share your story because
She almost started to fake a cry. You heard that?
doing it for the people that DM me. That say, thank you so much for being brave enough to share your story because the
She couldn't keep it up the facade though, unfortunately.
exact same thing happened to me. So I am grateful for those DMs.
Yeah.
People are starting to attack my business and my livelihood. And that's okay. I know what I have to offer is important. It landed.
Is she driving a minivan? Does she have kids?
In my lap. I'm not pretending to be something that I'm not. I help
No,
ADHDers
she actually fucking believes it, so.
get and stay sober. And
There's no such thing as an ADHDer, by the way. Somebody with ADHD, you're not an ADHDer. This isn't like a cool, fun thing. It's just a fucking diagnosis.
I help them with
Oh, it's K-Quick, not K-Swiss. Sorry, bro.
negative thinking and anxiety. And it's what works for me. And I've seen it work in my clients too. So if people want to drag me for the work that I do, that's okay. So I get that weird email from my therapist begging me to come back in for one more session. And so the next day is my next session with the psychiatrist. And I sit down in the chair and I bury my head in my hands. And he looks at me and said, so this is how we're going to start, huh? And I said, yeah. Because he hadn't written me back from my countertransference email. Big surprise.
Yeah, he set that boundary because you keep emailing him.
You know, any smart, which he was very smart. He was very, very professional. But any smart predator would have dropped me like that in that moment.
Why? Why would they drop you like that? You sent them a vague email about countertransference.
He should have emailed me back and said, look, this is getting weird. You need to find a new psychiatrist.
Why?
The office will contact you. But he could not let go of me.
I wonder if at any point he asked her if she would feel more comfortable with another therapist and she insisted on staying with him. Because that I would not doubt.
So instead of turning down the intimacy, he turned it up to a level 12.
What did he start doing?
And
continuously not hugging you back?
He showered me with so many breadcrumbs that next session. Because really, what I did when I told him that...
What does a breadcrumb mean?
I'm experiencing transference was I took 100% of the ownership for the dynamic that both of us were creating. So he rewarded.
It sounds like once this whole transference thing comes up is when maybe it starts to become more real. I wouldn't doubt that the therapist didn't even realize that when she said it was a crush that it was that serious to her yet. Or they're just having this conversation in like a more casual way where it's like, oh yeah, I think I have transference because of the crush I have. And he's like, oh, that's interesting. Let's like explore that just from a mental health perspective because you want to be some kind of a counselor. Yeah, maybe her POC therapist got white fatigue. True. So true.
Me. And he gave me little compliments like, if you weren't my patient, I would refer my other patients to you for your coaching services.
Wow.
That meant so much.
All right. Maybe you seemed fucking normal at that point. That's a breadcrumb, apparently.
Of course, because what he was saying with that is, I see you as a peer.
That's not what he's saying. That's what you think he's saying. He's saying that, oh, I guess you do pretty well when it comes to ADHD counseling. Like either people that have ADHD, I would send specifically to you for the help them, maybe to help them counsel away from ADHD. It's not that serious. You're taking it as like a peer. He's a psychiatrist. You're a fucking idiot. Like these are not even close to the same things. Like there's a difference between like you doing some kind of Alcoholics Anonymous for ADHD, or people with ADHD. I almost said ADHDers. Holy fuck! Versus you being a peer. You heard that. That's what you wanted to hear. You wanted to hear the term peer. You're not peers, man. You are not even close. You don't have anywhere close to the same accolades as he does. You're just a fucking. You're a stinky little goose. What are you talking about?
I see you as a colleague.
No.
What you're doing is important. I felt really recognized in that moment.
That's so good.
And sure, he could have said it professionally, but he did it on purpose. So
what did he say that was like? How was it unprofessional? Sorry, I'm just like cleaning my controller. She's boring the fuck out of me. My ADHD is going off. How is it unprofessional? What he said? What about what he said was unprofessional?
In that session, after the psychiatrist told me that he would refer patients to me if he could, if I wasn't already his patient.
Take that as like, oh, I guess I don't want to be your patient anymore then?
I asked him if he got my email and what he thought of my ChatGPT, of what he thought of Henry.
There's not much to think about it because like all you did was send like an examples of that. And it's somewhat vague. Like I don't even know if he would necessarily know that you were applying it to him. He probably looked at it and like, oh, okay. Like you basically sent him a Google search.
His response of countertransference. And the psychiatrist said, oh, I'm still thinking about what Henry said about countertransference.
I was like, he doesn't want to talk to you about
And
it.
I said, well, we talked about it a little more, and I want to read you something else. So I read the psychiatrist,
I thought
what
she
Henry
said that she wanted to have a conversation about breaking up with her therapist at this point.
had to say more about it. When he told you countertransference is common, it might have been his way of normalizing the fact that providers aren't immune to feelings. It's part of being human. What matters is how well they keep those feelings in check, which the psychiatrist's name clearly excels at. And as you can imagine, the psychiatrist loved hearing that. He loved hearing that because my AI mirror was essentially just saying, yes, he has feelings for you, but he just keeps...
No, that's not what it's saying. He might be engaging in projection of feelings onto you. But when she says feelings for you, she thinks it means romantic feelings. It's not what it is. Like, she's so fucking delusional. It's fucking crazy, honestly.
them in
She's
check
exhausting.
so well. He's so good at his job, keeping his feelings in check.
Please.
And
Oh, what a bad guy for liking hearing praise. Like, who the fuck doesn't like to hear praise? It's like, oh, cool. The AI model thought that. That's pretty nifty. That's how I would feel too. That's cool. The AI model thinks I'm a good guy. The AI model thinks I'm a bad guy. What the fuck? Fuck. And then I would just wage war against computers. I'd start pissing into my phone or something.
oh, the psychiatrist loved that so much. And what did he do? He rewarded me with my favorite breadcrumb. Intellectual stimulation, a fun metaphor, because he was watching me the entire time.
So this is the predatory breadcrumb, is intellectual stimulation. Just to be clear, before, she, like, I don't understand. Before, she literally said that she was like, she said that he was basically calling her a peer, but she didn't say it in a way where that was a breadcrumb. She said that more, from my interpretation, in a way where, like, he actually felt that way and it made her feel good and valid, because that's what she wanted to hear. But, like, no, wouldn't that be a breadcrumb too? But now intellectual stimulation is a breadcrumb. Like, what are you talking about? Clearly, she would present herself in a different way. Is she off, like, psych meds or something? Like, what the fuck is going on here?
I was his patient, and he knew what made me light up. He knew what got me excited, what I liked.
You light my world.
And so he thought for a moment, and he said, I'm feeling a salad of emotions right now. And I was like, what are you talking about? And he said, you know, a salad.
He was calling you fat. Trying to just get the word salad in your brain. Kind of fat. No, I don't think you're fat. That's just saying. Fine.
Salad of emotions. A beet of raw emotion. A tomato of surprise. And the salt amplifies it.
This is a fucking VeggieTales? What the hell's happening right now?
And I was cracking up at this point. He nailed it. I just thought he was so brilliant and smart in this moment. And I asked him, I said, what? Say that again. He said, yeah, you know, the beet, it's really raw. I'm feeling a lot of raw emotion. And the tomato of surprise, when it pops in your mouth, it's surprising. And I was like, oh.
Mouth is it surprising?
Okay, that's good. Yeah, this man at the...
Dude, you're like a fucking toddler. You were just like so impressed by a salad of emotion. Like, oh my god, you were fucking clapping your flippers like a still. Like, that was so impressive to you. What the fuck? You just find every little thing about this guy impressive. Weird. Salad of emotion. Holy fuck.
This point knew exactly how to make me happy and exactly how to pull away to make me try to work harder. And he gave me the biggest reward from Henry, my AI mirror, telling him that what he's doing is totally good and that his boundaries are so virtuous.
Wouldn't it be crazy if this guy really was some kind of a predator? And like he's just like he built her up to this point where she went onto the internet and she started expressing everything, and now everybody thinks that she's fucking crazy. And so now one day he's gonna reach out to her again and see if he could hit that shit, and he fucks her, and nobody will believe that it happened. So this guy's a fucking smart ass motherfucker. He's a smart dude. Holy shit.
A lot of things happened in that session after the countertransfer had slipped.
Cool.
And I also had my psychiatrist help me draft the email to my therapist who was begging me to come back in. And the psychiatrist said, I used to have respect for her. And what he meant when he said that was, I used to like it when she would feed me to you and have you deliver intimate content to me.
Content. But yeah, porn. No, what he's saying is apparently she's breached past multiple boundaries, in his opinion, and so it's something that he doesn't like.
The moment she started being sloppy, I lost respect for her.
I don't know what that means.
Right, I'm pretty sure that's what he meant.
I don't even know what you mean, so what?
When he said that. And people have asked if they were connected. Surprisingly, they were not. They had no idea. They had never met before. But I would go to my therapist every week and tell her how much I loved my psychiatrist. And she, loved hearing about that dynamic. It was so weird.
Wait, this actually kind of makes sense. So when she says loved my therapist, I'm actually starting to believe that she didn't even really tell her therapist that she was infatuated, romantically loved them. Because if I say, I love my therapist, do you guys think I want to fuck my therapist? Probably not. You're probably you really like them a lot. And I feel like that makes sense and that tracks because she's sitting here saying things like my therapist talks to me as if I'm a peer, right, from before. And so, if anything, my psychiatrist. And so, if anything, maybe this therapist is picking up on that and be like, oh, it's really nice that you love your therapist. That's really cool. Maybe it's combined. I love my therapist so much. He's really cool. I have a little crush on him. That statement in and of itself is very innocent. It's nothing crazy. It's not a crazy statement to make. So, that's probably the way I would imagine that she's communicating with these people, and she's putting so much energy into it, making it seem like it's so big, but it's really just I have a crush on my therapist. I love him a lot. He validates this, that, and the other thing, and he's so good with me, and I feel better with him, and I have a crush on him. It's so nothing. It's such a nothing burger. You know what I mean?
Yeah. So he helped me draft the email to that therapist to say, look, if I were to end up coming back, it'd be more for you than for me. And more on that in a later part.
Why don't you show us that email? You showed us the other emails. Why are you not showing us this email?
So then...
There's a reason she's not showing the email.
I read him a text from my longtime ex-boyfriend, who he had originally really liked, but I think my psychiatrist preferred me single. Because my ex-boyfriend, as most ex-boyfriends do, was begging me to come back into his life too. And I just kept saying, no.
Show those.
And I asked him to give me some space. And
show me any of these. She showed, once you start showing messages, I feel like you should show more.
He would not give me space. He said, do you still need space or can we hang out? And I told I asked my ex-boyfriend, I just said, why do you want to hang out so badly?
The fuck you?
And my ex-boyfriend texted me back, because it's been a few months since I've seen you and it's been on my mind.
Hey, he's trying to tap that shit.
And I was reading this text exchange to my psychiatrist in session.
Read it to us. Show it.
And I read what I responded to that weak line about why he wanted to see me. And
my longtime ex-boyfriend, but you saw him a few months ago. So you guys are on again, off again, fucking every once in a while.
Said, my self-respect is much higher these days than when we were in a relationship. I am only interested in accepting invitations for my time and attention that value me and recognize my worth.
Wow.
Being on your mind is not an acceptable invitation, and I decline.
That is so weird, but okay. Way to set your boundaries, queen. That communicates to me, though, that she has an issue with going back and forth between guys. If they're like, hey, you've been on my mind, and she's like, okay, I'll fuck you. Which, again, tracks with her ADHD and her impulsiveness. But now she's like, no, I am worth more than just sex. Great, good for you, queen. Good.
And my
ChatGPT response, true.
psychiatrist just looked at me and
you start
said,
jacking off right away. Like,
I bet your ex had to read that twice. And this was another thing about the psychiatrist, okay? He couldn't ever just give me a regular compliment. It had to be those weird sideways compliments. Instead of, I'm so glad that you're setting boundaries with your ex-boyfriend and growing your self-respect, it's, I bet he had to read that twice. Or it's not,
what the fuck are you talking about?
I'm really proud of you for growing your coaching business and finding success. It's, I'd refer my patients to you if you weren't already my patient. Right?
You got to get a job. Get a real job. You're fucking boring the shit out of me at this point. This is exhausting. You know, after we hit part 16, it's downhill.
Right? These
Every
are what
14.
I mean when I say breadcrumbs. He was a master at them. And this is
Maybe he was a bird.
how.
She does look like a bird. I guess, you know, birds like breadcrumbs.
So looking back, I know that I was not his first victim for his fantasy supply.
Yep, so true.
Because
queen. So true.
he was too good and too slick
Too slicks.
up until
Just like that pussy was when you thought about him.
he caught feelings. Then he started getting sloppy.
Yep.
People are asking me for more concrete evidence, and this is when the concrete evidence really starts, because this is when he himself started to get sloppy.
Not for nothing. If I jumped off the top of a 100-story building onto this concrete evidence, I would probably survive. That's how non-concrete it is.
Because what was happening was, when I had started to see him 3.5 years before, I was a nearly perfect supply source for him. Because what did I have? I had low self-esteem, boundary issues, daddy issues, so I put
What did I say? What did I say? Daddy issues. Write that down. Write that one down.
him on a pedestal. I know a lot of you ladies out there can understand that with men.
Well, I mean, you just fucking self-reported, you dumbass bitch. What the fuck you talking about? Your fucking daddy issues. Like I fucking said at the beginning of the goddamn video. Like fucking minute 2. She's got goddamn daddy issues. Oh, there we go. Fucking beet salad. Her dad probably made her beet salad. Really raw emotion. I'm not saying he would fuck her. I'm saying he would hit her. Okay? Maybe he was right. No, I'm just kidding. That's... But holy fuck. It's fucking daddy issues. What's so interesting is didn't he help you get to a point of like non-dependability onto him? So how is he a predator?
And in positions of power. And he went right to work exploiting me. Right
Crazy.
to work.
That's crazy, girl.
Grooming me.
Whoa.
Like, and he was very
It worked because you went from putting your hair up and looking like shit to like putting your hair down and looking nice.
successful at it. So he was in a paradox, right? Because he loved watching me get stronger because I gave him better intellectual supply.
So he found a weak, vulnerable, emotionally unstable person and then made them more emotionally stable so that he could have stimulating conversation with you. He groomed you to be smarter so he could talk to you. That's fucking crazy.
But I also threatened the supply source. A lot of...
What the fuck are you talking about? This woman's a fucking idiot. All right, we got 2 parts left. There's part 18, and then there's part 19. And then maybe there's new parts. Who the fuck knows? Boy parts, girl parts. I bet she was thinking about his boy parts all the time with her girl parts. Here's part 18. Here it is. 4 more minutes. Oh my goodness. I'm getting abused.
The last 2 videos and this video was all the same session in February of this year.
Oh my God.
The counter-transference slip happened in January. How I decided to end this session was I looked at the psychiatrist and I said, a couple weeks ago on the full moon when I was ovulating, I had a dream about you.
That's fucking crazy.
And he was like, oh yeah? And I said, yeah. So I told him this.
Cool.
And I said, yes, we hooked up right here in this office. And he all of a sudden just looked so uncomfortable.
Sounds about right.
He didn't say anything. He couldn't look at me. He couldn't breathe.
So you told him a story about how you guys had sex on a full moon while you were ovulating. I'm assuming that part of this is that she's like a 40-year-old woman that wants a baby, and she doesn't know how to interpret that feeling, and he's uncomfortable now. Okay.
And sure.
And now, of course, to her, the uncomfortableness is that he wants to fuck her pussy and impregnate her. But he can't do it. He doesn't feel like he could do it. Because he knows he has to set the boundary. He's trying so hard to resist his boundaries. He's like a werewolf. He's like a werewolf. He's a werewolf under a straw hat the moon can barely pass through. His hairs are standing up on the back of his neck. They're growing out. He could feel his nails turning into claws. His teeth are sharpening, but it's not quite enough exposure because that's that hat. That straw hat. Those are his boundaries. And they are standing firm, stopping the full transformation. So you can only see pieces of it. Through his attire, through his robe, through his hat. You can see one eye slightly red in the middle. Right? Snarling. This is what we're doing here. Oh! This is so fucking dope.
Sure, maybe he was uncomfortable because he didn't like me saying that I had a dream where we hooked up, but...
Yeah, maybe he didn't sound comfortable because a white woman saying I had a dream. Is that cultural appropriation or what? Am I right, my peoples? It's fucked up, dude.
But he could have said that.
I had a dream that the back of the bus would actually be the cool place. And Papa Gut was not allowed to sit back there, and it made him upset when he was younger.
But he didn't. You want to know why he was uncomfortable? Because he had...
His dick was hard? What?
Probably played out that fantasy so many times in his head.
You know what? That's it. You're right. You're right.
And there I
Bazinga.
was, speaking it back to him.
Wow, he's probably started jacking off.
And it was like I had psychically downloaded one of his fantasies.
Typical Pisces, am I right?
I continued and I said, yes, we hooked up in this office. And I really liked it while it was happening. He could not move or breathe. And then I told...
A white woman making a person of color not able to breathe is pretty fucked up. Didn't I sit in the front of the bus as the driver? Intro.
Told him, as he was still looking very uncomfortable. Then when we were done and I left, I was distraught with sadness. Because in the dream, I thought, I cannot believe that he crossed boundaries in that way.
You're the one who told her about a fucking story. What are you talking about?
Because his boundaries are so important to him. And then I told my psychiatrist that I woke up and thought, oh my God, it was just a dream. Thank God.
She woke. Oh, and then he got upset.
It was like my psychiatrist turned into a little boy.
Whoa, she's a pedophile. I knew it.
He looked at me and he said, so you do like my boundaries?
I'm so he said that? What?
And I said, I love your boundaries. I hate your boundaries, but I love them more.
I don't even know what's happening anymore. This didn't even happen, I don't think.
There's the push and pull, the trauma bond.
Whoa! Now we're traumatized. Hey guys, I'm much more... Didn't she just say like a minute ago that she's much more mentally and emotionally stable now? What are you trauma bonding over?
Because once again, he
groomed me to have intellectual conversation, and he made me emotionally healthier for that. But then also, I'm traumatized.
Boundaries as protection while exploiting me.
What the fuck are you
So I
talking
told
about,
him
dumbass
about
bitch?
what happens when I ovulate, and
that's something that if maybe like a pussy doctor would talk. I don't think he needs to hear that, girl.
my desires, and he listened, because of course he did. And then I decided that it seemed like enough time had gone by, and I put my shoes on and started heading to the door. And he met me at the door, which he does not usually do. He didn't ever do that. He just let me leave.
You guys only had like 2 in-person sessions. And like the first one, you hugged him and said you had a really special relationship, but he said no. So, and also it seems like you abruptly got up and went to walk out.
And we stood at the door. And I was like,
you had sex.
Will you get the door? And he scrambled. He was like, oh, sure. So he went and got the door. And then
He fucked me in the ass.
He followed me down the hallway.
Yeah, that's crazy. You think he had another appointment that he wanted to wave in?
To the foyer.
I don't even know what a foyer
And
is.
watched me exit. And he asked me, he said, see you next month? See you next month? He hadn't ever asked me that before. And I looked at him and I said, maybe. And I walked out the door. And I saw that man had let us go 15 minutes over session. And that is when, the special treatment started, the longer sessions. He usually gave me an extra 5 minutes, but yeah, the sessions got longer. And I got to my car.
Who cares if he wanted to fuck her? Like, here's the thing. Let's say this is true. Maybe that she said that and it excited him a little bit. Maybe he's like, oh, fuck, that's kind of exciting to hear. And he knew that there was a boundary and he had a feeling about it. But that doesn't mean that everything else is accurate. Nothing else she said was accurate. One thing that might have been accurate is she told him that she had a sex dream about him, and it might have made him interested because it probably hit him in the ego. And he wanted to hear it more. All right, I don't care. I don't give a fuck. Like, I don't give a fuck. That doesn't mean that everything, even if it's true, which I don't even know, even if it's true, it doesn't mean that everything else is valid. It doesn't mean that everything else happened. You preposterous fucking weirdo. What the hell?
I was just like, oh my God. That was the most intense session we have ever had.
That's how she talks, in my opinion. But there's one more. There might be two more.
Some people asked what it...
Oh my God.
Oh, hi there.
All right, once we're done, we're done. Like, we're 18 and a half. We're done with 19. Hurry up. Hurry up.
To take the morning and afternoon off of TikTok today, as you can imagine.
Oh.
This has gone beyond what I have ever imagined. And it's also proving to me how important it is that I continue to tell my story. I'm aware that many people...
I'm a werewolf. Honestly, like, I just hurry the fuck up and finish this goddamn story already, you asshole.
Hi there.
What are you, Obi-Wan Kenobi?
I had to take the morning and afternoon off of TikTok today is that I continue to tell my story. I'm aware that many people don't believe me, think I'm lying, think I'm fabricating, and that's okay, because I'm telling my story for the people that are going to hear
Imagine it's all fake, and she's like a super good rage baiter.
it, the ethical providers, the other survivors. Let's talk about my former client who's getting a lot of traction. I wouldn't know because she blocked me. This one is especially hard for me because she's someone that I also considered a friend. My only client that I've ever had that was my friend first. And
whoa, sounds unprofessional. I'm assuming that we are referring to one of these bitches. I know who we're talking about. I think I have her up here somewhere. This user. Yeah, Emily.
And so her betrayal is extra stingy. It's okay if she wasn't happy with my coaching services. I have plenty of clients that have finished 12 weeks with me and then re-signed for more coaching. And the way that I left it with this client/friend who's on here spreading what she wants to...
12-week course. Hey, all 12-week courses are really good.
Spread was she told me that she was going to leave me a positive review, film a testimonial video for me, and she seemed really happy. So if she wasn't happy, that's on her to tell me what she wasn't happy about so we could make that right. And if she wants to say that I scammed her, that's okay. If she wants to say that I forced her to stay on the phone while she made her first payment, okay, her card got declined and she seemed really flustered, so I said, I'll wait with you, no problem.
Crazy.
And yeah, she was really apologetic. I'm like, yeah, it's totally fine. And she also said I told her to use ChatGPT. I tell my clients all the time to use ChatGPT because it's a huge tool that I use. So I use it for all different sorts of things.
Is that like, you think that's a good thing for people to use ChatGPT in place of thinking for themselves?
So if I found something helpful in my life, I'm going to share it with my clients. And if she wants to come on here and take advantage of the internet piling on me and pile on me as well, okay. The other message is that the yoga studio I taught at, I no longer teach at. Enough said. Please leave them alone. Third is I'm horrified that people are putting the psychiatrist's photo, full name, family information. I couldn't even find that. You guys are intense. And it sucks. It sucks.
He just keeps talking about it, though.
I will continue to tell my story because it is the truth. It is the truth. And people really don't like my truth.
We're just rehashing stories over and over again.
Okay with that. Because it just really threatens people's thinking that all psychiatrists and mental health professionals are safe. And I just want to let people know that it's okay if you run into one that isn't so safe. That's why I am here, to share my own story. And I do want to say thank you so much to all of the ethical therapists who have reached out to me to thank me for sharing my story and to tell me that they believe me. I've seen some of them try to make videos defending me and they get absolutely dogpiled. So most of them take them down. But I see you. I hear you. Thank you.
I guess this wasn't meant to be watched one after the other.
Something I forgot to... Some people asked what it means when I put on my shoes at my...
Wait, is there another part? What the fuck? What the hell? Oh no, we just watched this.
Some people asked what it means when... Oh, hi there.
Oh no, we
Some
didn't.
people...
Oh, there's so many more. There's 2 more.
Some people asked what it means when I put on my shoes at my psychiatrist's office. I have ADHD. I do not like wearing shoes. I like sitting in chairs weirdly. So usually when I go anywhere, I just kick off my shoes and sit in a chair weird. If you know, you know. Okay? So when I got to my car, I was like, oh my gosh, like, what was that? And did he just say see you next month? Because it was weird. So I go home, kind of rattled, just like, wow, that was intense. And I decided to write the email to my therapist. I'll put it right here. The one who had begged me to come in for another session, who was also having...
Ugh, another fucking email. God damn it. Begged you? She just said that she wanted to have like an outro interview thing. Fucking begged her. Yeah, it never ends. I feel like part of this is just like content. This is crazy. Hi, I realized I did not give you a prior notice that I intended for our relationship to end, and I understand that endings are important. You have helped me so much, and this ending has been a long time coming in my head. The closure that we had yesterday felt adequate, and I left your house feeling happy and complete. If I came back for another session, I would be more for you than me. If it wouldn't help, I'd be happy to fill out a form if you would like to send me one. Thank you again for the positive transformation and help me in my life. Blah, 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 blah. Hi, Kendra. Thanks for your warm response. It was part of the clinically integrity to invite you for a closure session after 2.5 years working together. 2.5 years working together. I understand that you're growing through other modalities now that I support and am excited about that for you, whatever. Although my preference is to meet again and tie up my records with a pretty bow, I certainly honor and value your experience of completion. Intended only the best for you as your life expands in untold miraculous ways with warm gratitude. These are fine. These are fine. These are not like anything. There's nothing wrong with these.
Inappropriate boundary crossings with me. And so I just told her, I was like, look, I understand it was sudden, but if I were to come back in, it'd be more for you than for me. And
it's interesting that she only shows some emails and like not other emails. She'll reference emails and text messages, but she'll only show us some stuff. It's weird.
Happy to fill out a form, right? Here, give me a form to fill out for your notes. And then she said, it's a part of my clinical integrity to invite you back in, to put your needs above mine. Your clinical integrity? Yeah, I did not write her back. I did not write her back.
Yeah, there was no reason to. She didn't give you a reason to write her back. And like, yes, it makes sense. And also, just because you think that you're done doesn't necessarily mean that you are. She was just saying that she wanted to tie up some like probably like outer view, whatever questions.
And it was in this week where a bunch of stuff, you know, just started to shift. Like the week after
my balls
was Valentine's Day, and that same ex-boyfriend, the one that was, you know, also not respecting my boundaries, who said, "Can we hang out?" And I said no. And then he texted me, "Happy Valentine's Day." So guess what I did?
Nothing.
I blocked him.
Whoa.
And guess what happened? It felt so good to block.
That's crazy that you're at the development cycle of a 14-year-old girl. That's like so impressive for you, girl.
Block him.
Good job, girlfriend. You blocked your toxic ex that just wanted to hang out and hit it. Whoa, you're so mature. How old are you?
And it just got me started thinking like, oh, what else is taking my energy?
Whoa.
What else is taking my power? What else is taking my vital resource, right? So it just kind of set this.
I don't know, water. Stop drinking water, I guess, or something. You seem like a fucking...
Something I forgot to mention about that February session is...
God, this is
Something
crazy.
I forgot to mention about that February session is that I did ask him why he stopped responding to my emails. Because I thought that the countertransference email he was definitely going to write back to. Because, like, let's talk about that, right? But no, I had to bring it up in session, where he usually brought up what I would email him in session. So that was the difference. So after the intimate dream confession, as I was leaving and he was following me, I asked him, I said, do you like it when I email you? Because I realized that you're just not writing me back. And he said, well, it's not that I don't like it. It's that I wonder, why does she do it? And I looked at him and I said, it's because I want attention from you. I was honest. I'm an honest person. Sometimes too honest. So I told him, I won't email you anymore. Another thing that happened after that session was I was waiting for my pharmacy to text me that my script was ready. And I called them and they said, oh, yeah, we didn't get your refill.
Oh, like, that's crazy. That never happens at doctors. There's never issues with the refills. My wife literally called me on the phone because we had an issue with a refill.
What? So
During
I
the
called
segment.
the office staff, and it was so unlike my psychiatrist to miss my refill.
Whoa.
That man operated as a doctor with surgical precision. He did not miss a refill.
Whoa.
No. So
he wanted her attention. Got it.
this is why he was very affected by the intimate dream, why he followed me out to the foyer, why he said see you next month. He was affected. And even the office manager was like, haha, I can't wait to make fun of him for forgetting your refill, because it was so unlike him. So he sent my refill in, got my refill for the month, and then I started spiraling with just how strong my feelings had gotten for him. That man knew exactly what to do to keep me seeking his validation, and it was working. He also was psychologically trained on how to keep me attached to him, and that was working. And it was like a torture chamber in my mind, but I thought it was love. So I blocked that ex-boyfriend, and what I'd like to say is that when you block people from your life or remove them from your life that are draining you, the universe will reward you with good things. So I've been making content on Instagram for months at this point about ADHD, and a couple days after I blocked my ex-boyfriend on Valentine's Day, I went viral on Instagram. Like millions and millions of views on this silly reel that I posted about ADHD and alcohol and how ADHDers often use alcohol to quiet their brains. It really helped grow my business, and it just made me so much stronger and that much better. I'm here today sharing my story so I can heal more.
And some of the ethical providers have clocked that I'm showing up messy because I'm still processing trauma.
What business is she talking about? This is what's getting me, because, like, she doesn't have it on. She doesn't have it on her, like, on her page, so I'm confused. Is this her? Oh, she has the account private. Oh, I think this is her. Helping ADHDers, that's definitely her. Kendra Hilty. Okay. It's a bullshit course.
Hi everyone, my name is Michelle, and I am a singer, an artist, a creator, and I work in corporate America. Working with Kendra has really changed my life.
I don't care. Probably not positively. Let's see how much she charges for this outrageous shit. 45-minute strategy call. Sir, let's do it. Are you fucking kidding me? You like how it doesn't tell you how much it costs until after? So what this looks like is that it looks like you have a free strategy call for 45 minutes, and you put all your information, potential social media account, other things in here as well, and then you schedule the event, and then afterwards is when she'll tell you how much the session costs. So it's probably an egregious amount of fucking money. Gotcha. Huh. Interesting. Not really that interesting.
I'm still processing being attached to a man whose professional training was how to get into people's heads. And it's not lost on me that the internet is dogpiling me from speaking from the exact state that the psychiatrist put me in. I've been going live every night since I started telling my story because I did have to turn the comments off. I was so tired of people diagnosing me in the comments and also doxing my psychiatrist in the comments. But it's been really fun answering questions in the live, and I have a great mod team now, so thank you so much to everyone who's volunteered to mod for me. If you want to come and be respectful and ask nice questions, I'm happy to answer them on my live tonight at 6 p.m. Pacific.
All right, we haven't gotten the resolution, and as much as I want to not, I think that like what I needed to do through this is like take a break after like 10 parts and like try to do like 10-part sessions. But we got through the first 20, and so honestly, we just have to wait for more before I do anything with this fucking video.
Something I forgot.
Because this is from 4 hours ago.
Some people ask
she
what it
seems
means.
to post a couple videos a day, so I guess we'll check back in.